We resume this meeting of Finance Committee. Please be seated. Before we took the luncheon break, we had concluded with appropriations to the Honorable Minister of Tourism and Trade Development, and now we come to the final group of appropriations to the Minister for Health, Environment and Sustainability. As we have done, we will invite the Honourable Minister to provide a few brief remarks to the committee. And just by way of housekeeping, Minister, has the statement been distributed physically and electronically?
Good afternoon, Mr. Chair. Thank you. The statement has been emailed, and I believe that it's been uploaded on ShareFile. However, the ministry team does have the hard copies, which will be provided in short order.
Excellent. Please proceed.
Mr. Chair, would you like me to wait until members on the opposition have received the hard copies?
You're distributing them now.
Thank you, sir. Mr. Chair, I'd like to thank you for this opportunity to share a few brief remarks. This budget marks a shift in our approach from reacting to challenges to proactively preparing for them. It emphasizes prevention, partnership, and accountability. We are investing in systems that safeguard health, promote equity, and protect our environment for future generations. In this way, we reaffirm that sustainable growth begins and ends with our people. Mr. Chair, thank you for allowing me, just want to again say thank you, for sharing a bit about what this budget covers for the next 2 years. Our mission is clear: to create systems that transform care delivery, protect our environment, and build a healthier, more resilient Cayman. This vision stands on 3 pillars: the health of our people, the protection of our natural resources, and the sustainability of our communities. Each pillar supports the others. When our people are healthy, our environment is protected, and our community is strong, Cayman is not only prepared for the future, but is poised to shape it. This budget reflects a shift in our approach, from reacting to challenges to proactively preparing for them. Sorry, 1 minute, Mr. Speaker. It emphasizes prevention, partnership, and accountability. Sorry, it's a bit repetitive here. I just want to make sure that I'm not boring anyone. So what I'll do is I will start with outlining several key elements of the health aspect of our budget. First, I will begin with the National Health Strategy and Plan. When I assumed this role, I noted the absence of a single coordinated framework for improving population health and strengthening the healthcare system. The Cayman Islands' previous National Health Policy and Strategic Plan, developed in 2012, has expired in 2017. Since then, our healthcare landscape has evolved, and so have the challenges we face, from rising rates of chronic disease to the needs for stronger public health infrastructure and more equitable access to care. The National Health Strategy and Plan will unify our efforts to enhance both physical and mental health across all communities. It is more than a policy. It's a comprehensive roadmap for a healthcare system that is inclusive, resilient, and responsive to the needs of every Caymanian. These reforms will also enhance system efficiency and are expected to reduce costs for government over time. The strategy is evidence-based, community-informed, operationally focused, financially sustainable, and inclusive. Among our top priorities is the implementation of the STEPS National Health Survey findings, which will guide our efforts in preventing chronic illness. A key initiative is the Pan American Health Organization HEARTS initiatives aimed at reducing deaths from cardiovascular disease, which is a leading cause of mortality. This initiative will standardize essential medications and increase public awareness. The HEARTS initiative is designed to strengthen primary healthcare systems by improving the diagnosis, treatment, and management of hypertension and other related conditions. The goal is clear: to make HEARTS the standard model of care for cardiovascular risk management across the Cayman Islands. Mr. Chair, the urgency is clear. In our islands, nearly 1 in 3 adults has elevated blood pressure, and many remained undiagnosed. I'm quite sure mine is high right now. Through the HEARTS program, we aim to improve treatment and awareness, especially among younger adults and men who are often less aware of their conditions. We are also enhancing public health by transforming our public health department into an independent entity. This change will empower us to be more agile and accountable, allowing for faster decision-making and better interagency coordination. Since becoming the minister, I've taken to Cabinet the proposal to separate the Public Health Department from HSA to facilitate a strong and independent national public health department. We've started with a phased approach, which is a public health unit, as this does not have any additional financial or civil service implications and will allow us to begin this separation from the 1st of January 2026. Having a national public health department will significantly aid in preventative care. By focusing on prevention, we will implement comprehensive health promotion and disease preventative programs that target risk factors associated with chronic diseases and heart disease. These are major burdens on our healthcare system. By emphasizing community education, screening, and early interventions, we can help our residents adopt healthier lifestyles and identify health issues long before they escalate. This proactive approach will lead to a healthier population, reducing the demand for more expensive, acute medical interventions, and in turn, lowering overall healthcare costs. The Public Health Department serves as the first line of defense in protecting the health of our population and plays a vital role in monitoring and controlling communicable diseases, including public health programs and outbreak response, promoting maternal and child care, conducting health surveillance and research on a national level, which informs national strategies and helps us to respond to emerging health threats, educating the public on nutrition, chronic illness prevention, and of course, mental wellness. And this is all done with working with international bodies such as PAHO and the WHO to align with global best practices to access technical expertise. We're also preparing amendments to legislations as part of the transition to the National Public Health Department. The changes will place a clear duty of care on practitioners to report cancer and other specified communicable diseases. This measure strengthens the country's ability to track conditions that affect the health of those who live in Cayman, and it also supports earlier interventions, as well as improves how resources are directed to the areas of greatest need. Mr. Chair, in conjunction with our public health initiatives, I'd like to now turn to a subject that's the top of my ministry's list of priorities: mental health. Mental health challenges, as we all know, are rising, especially amongst our young people. The National Drug Council's 2024 student survey revealed that 1 in 4 students in the Cayman Islands has considered suicide, and 1 in 8 has attempted. Many spoke openly at the Inspire Youth event about loneliness, pressure, bullying, and feeling unseen. Their message was honest and urgent. These young people need safe spaces, they need support, and they need a government that truly cares. We recognize that building a healthy, sustainable Cayman begins with caring for our people, mind, body, and spirit. My ministry is responding with a renewed focus on prevention, early intervention, and strong community-based mental health support. Stronger community-based mental health support. This is how we turn concern into passion, compassion. This budget provides funds for the construction of a new mental health facility designed to serve youth and adolescents, as well as adults, in an effort to enhance patient care, improve operational efficiency, and reduce long-term healthcare expenditures. We also know, Mr. Chair, that something needs to be done to address the pressing needs of the youth population now. That's why our budget also reflects the establishment of a 4-bed, age and gender segregated inpatient ward designed to provide specialized treatment and care for adolescents experiencing acute mental health challenges, while at the same time we focus on building the mental health facility. Additionally, we will introduce a mobile mental health nursing team. This will provide rapid response by way of a mobile clinic that can clearly deliver on-site community interventions and crisis support to children, adolescents, and adults. This new mobile unit will bring care directly to the community, ensuring that help reaches people where and when they need it most. Access to care should not be a barrier to services, especially in crisis situations. By introducing this mobile unit, our hope is that the people in crisis get the help that they need from qualified professionals in a timely manner. This is preventative mental health care. By having nurses back in the community, ensuring that patients receive their medications will prevent what we are currently facing, which is having many patients requiring acute care. This shift will enhance the overall quality of care, allowing the healthcare providers to dedicate more time and resources to complex cases that require immediate, specialized attention. Mr. Chair, as we continue to address the growing mental health needs of our people, it is vital that we strengthen the systems of care that support recovery and reintegration. Treatment does not end at every crisis intervention or hospital discharge. It extends into the community where individuals rebuild their lives with dignity and purpose. The Ponciana Rehabilitation Center plays a critical role in the continuum of care. Through its advisory council, the Ponciana Rehabilitation Center is strengthening clinical oversight and expanding its programs while maintaining its original mission and orientation. The center remains committed to its rehabilitation model of care, delivering a personalized, recovery-oriented approach that supports residents in developing the skills needed for independent living in a home-like environment. Family and community involvement remains central to the rehabilitation process, and all residents are required to take an active role in programming. I can speak more expansively on the future plans of the facility when we get to the output appropriation. What I didn't expand on in my speech is also the Caribbean Haven facility, so we can discuss that a bit more as we get into the appropriations, but that is also an area that is committed to rehabilitation and support in those areas that I just discussed. Mr. Speaker, we cannot speak about youth mental health without speaking about child safeguarding. And I said Speaker, Mr. Chair. I want to thank our partners in education and social development who have led the charge when it comes to this work. But I stand here today to assert that the safeguarding of our children is a priority for health, and one which will see a much more visible and dedicated effort. It is imperative to have framework in place to ensure that our children are safe, especially in our healthcare facilities, and it is something that we will be implementing in partnership with the Ministry of Social Development. My ministry team will also be working on the implementation of policies, programs, and training initiatives for healthcare providers designed to protect children from abuse, neglect, and exploitation within healthcare settings. Our aim is to strengthen interagency coordination, promote community awareness, and ensure that child protection standards are effectively upheld across the Cayman Islands in every sector. Safeguarding will be incorporated in our work for the development of standards to training requirements, vetting, and registration. Healthcare professionals are duty-bound by the Children Amendment Act 2024 to report, yet it has become clear that significant work needs to be undertaken to ensure that this requirement is upheld and all practitioners have policies in place to fully fulfill this duty. Mr. Chair, this government is keen to develop solid foundations upon which both we and future generations can build upon. The development of national frameworks will provide us with foundations that help to create and maintain high standards of healthcare while also modernizing the way that regulatory work is done. For far too long, the Cayman Islands have operated without the coordinated health regulation that our growing community truly needs. It's time that we change that. First, we must acknowledge our starting point. Decades of fragmented systems and outdated standards that have left gaps in patient safety and public trust. We owe it to our people to bring order, clarity, and accountability to our healthcare system. I plan to do that by introducing practitioner codes of practice that hold our clinicians to the highest possible standards. To do this, Mr. Speaker, I keep saying speaker like everyone else. Maybe we're speaking something into being here. To do this, Mr. Chair, we need greater investments. I don't mean now, because you're a wonderful Minister of Finance and Education. We need greater investment into the Department of Health Regulatory Services. We will continue to support the department's online service platform and process improvement project, which will allow the department to effectively meet the evolving needs of its stakeholders in an efficient and timely manner. The implementation of a digital service platform coupled with process improvements will enhance service delivery, streamline operations, and strengthen regulatory oversight. This initiative will also enable the department to effectively manage growth within the health insurance sector and adapt to ongoing amendments to the acts and regulations that govern its mandates and deliverables. I'm also happy to elaborate more on the digital platform when we get to that line item, but I'm pleased to say that we've already started with phase 1 of the initiative. My team will also continue to advance the legislative framework that is needed in order to ensure that ours is a modern, responsive, and equitable healthcare system. Updates to the Health Practice Act will also serve to create clinical standards of practice within our islands, ensuring quality care for all. Work on amendments to the health insurance regulatory framework is ongoing, Mr. Chair. A significant number of proposed changes aim to streamline and improve various operational aspects, including the processes for approving, renewing, and withdrawing of approved insurers. These proposed changes to the Health Insurance Commission will also improve the regulatory processes of employers and employees. While we also recognize the importance of more efficient operations and the need to adopt a more data-driven approach to decision-making, our primary focus remains on addressing concerns about how health insurance is currently being offered and find practical solutions for a more cost-efficient health insurance system. I'm looking forward to working together with you on that, Mr. Chair. The Pharmacy Act 2024, which many may remember, was a landmark reform that replaced the outdated legislation from 1979. It introduced clear licensing requirements for importing, manufacturing, wholesaling, and dispensing of medication. It empowers the Pharmacy Council to approve medicines based on international standards and allows for emergency use authorizations in times of national health crises. It also bans internet and mail order pharmacies without a physical presence on island, protecting our population from counterfeit and unsafe drugs. I want to just take a moment to commend former Minister Turner for getting this act passed. Subsequent to the act is the pharmacy regulations, which are underway, and once the regulations are approved, will allow for the enactment of the Pharmacy Act, and these will all be supported by the Department of Health and Regulatory Services inspection team that has now been expanded to include dedicated pharmacy inspectors. Other efforts to modernize our healthcare system, Mr. Chair, will include the implementation of an electronic prescribing system to streamline the prescription process, enhance patient safety, reduce medication errors, and improve coordination between healthcare providers and pharmacies across the Cayman Islands. Mr. Chair, our health and environment are intricately linked. Healthy environments with clean air and water, access to green spaces, and nutritious, locally grown foods help to support good physical and mental health. And I think we can all be proud of the environment that we live in here in the Cayman Islands. Preservation and protection matter everywhere, but in Cayman, they are particularly vital. Our connection to the land, the sea, and our heritage gives us a sense of identity, of belonging, and of purpose. Foundations that are essential for mental health, well-being, and a resilient community. And for those who don't think that they are connected, just take a drive and sit by the ocean after a long day of work. Moving on, Mr. Speaker, Mr. Chair, to a matter that touches every household, every business, and every community in our islands. That matter is waste management, usually discussed within the context of the Georgetown landfill. For decades, we've known that time and capacity are against us. The 124,125 tons of waste sent to the landfill last year exceeded previous projections made 10 years ago, which estimated a worst-case scenario of 80,000 tons per year. We know this has to do with the population growth, but it is where we are at. We have the data and models that demonstrate just how quickly our landfill capacity is diminishing. For example, according to the data from the Department of Environmental Health, out of the more than 124,000 tons of waste that is deposited in the landfill in 2024, 60% of that came from commercial waste, and 70% was from vegetation or vegetation waste. Sorry, I meant 17. Thank you. I'm glad you guys are reading. and 12% came from household waste. By contrast, other small island nations in our region are already diverting more than half of their waste away from their landfill. Barbados, for example, according to their 2009 national report to the United Nations Commission for Sustainable Development, diverts up to 70% of its solid waste away from the landfill through various facilities for processing metals, construction, yard waste, and recycling. And Bermuda diverts almost all of its municipal waste through their waste-to-energy facility. Mr. Chair, we can and we must do better. We now know, based on the latest models from the Department of Environmental Health, that if we don't implement an interim plan, we have approximately 5 to 7 years before reaching capacity at the Georgetown landfill, with limited contingencies for emergencies. And this is not the first time this has been spoken into this chamber. We've heard that for a very long time. This government's SPS includes a specific outcome: the development of a sustainable, cost-effective waste management strategy and plan. My ministry team and I, in consultation with subject matter experts, have reviewed what is already in place, including existing project contracts and land agreements. We are now able to act, and we do not have to start from scratch. And I will say this publicly, this is no ISWIMS 2.0. Mr. Chair, as you know, we've had to end our project agreement with the DART-led consortium for the integrated solid waste management solution due to the fact that it was not value for money, amongst other nuances that I won't go into today. For those who would like to know more about that, I'll direct you to the report produced by the Office of the Auditor General. Mr. Chair, we could not move forward with any plan that would place generational debt on our children and our grandchildren. The approach must be financially responsible, technically sound, and workable across sectors. The way forward, therefore, requires a multifaceted approach that addresses waste generation, waste diversion, and waste treatment. This also requires changes in how we consume and dispose of materials. We all have a collective responsibility to reduce the amount of waste we produce. Government can provide systems and policy direction, but the volume entering the landfill reflects daily decisions made in homes, in businesses, and commercial operations. We have, Mr. Chair, a proposed 10-year plan from 2025 to 2035. To start, our goal during the next 5 years is to reduce the amount of waste heading to the landfill, buying us time to deliver on the proposed National Solid Waste Plan and build a new solid waste facility. We'll be prioritizing the 3 largest contributors of waste to the landfill, as I mentioned earlier: green waste, recyclable waste material, and household waste. The objective is to build new processing facilities and safely manage those major categories of waste. Mr. Chair, our plan is incremental and starts with developing both a recycling policy and a business case for each of those mentioned facilities at the same time. We will begin the required 3-stage business case for the new solid waste facility, and once completed, we can then begin waste management works. Rolling out recycling and diverting from the landfill is a part of the overall strategy. We have the benefit of beginning these works as early as next year due to the phased approach that will be taken, and that's 2026. We must work together, businesses, households, government, and non-government organizations, to reduce the amount of waste we generate. The proposal will promote and encourage recycling, and that is an important component. But recycling on its own won't solve everything. That is why I am proposing this joined-up cohesive plan, prioritizing the construction of processing facilities that will have the most impact on waste reduction. The timeline, yes, will be tight, but passing the proposed recycling policy and strategy, which will be developed early next year, and then starting the RFP and construction of these 3 priority facilities will win us time and capacity. With this new waste management plan, implementing facilities to increase recycling, I believe we can decrease the volume of waste going to the landfill and extend the landfill's lifespan. Mr. Chair, the budget allocates $993,000 over 2 years for OE 152, maintenance of the completed Georgetown landfill remediation works phase 1, and $2,078,000 Cayman Islands dollars in HES 1 for the provision of comprehensive project management, technical, legal, and financial advisory services to support the implementation and optimization of the National Solid Waste Management Plan. In addition, within EI 194, we have allocated $6 million towards our solid waste management plan and programs that I just spoke of, those 3 separate facilities. One such project is to replace the medical waste incinerator at DEH. Mr. Chair, the medical waste incinerator is the primary system for safely destroying potentially infectious and biohazardous waste, processing 500,000 and 800,000 pounds annually. The existing unit is approximately 20 years old and does not meet modern environmental or operational standards. The incinerator requires frequent maintenance and costly major repairs, resulting in prolonged downtime each year during which medical waste must be stored. To ensure the safe and sustainable treatment of medical waste, a new incinerator housed within a dedicated building and equipped with modern emissions controls and monitoring systems is essential. Mr. Chair, we have also assessed where we can upgrade and enhance equipment and fleets for the Department of Environmental Health operations. Laboratory upgrades at DEH will enhance testing accuracy, environmental monitoring, and compliance. Modernized waste management improvements will boost landfill efficiency, reduce environmental impact, and ensure long-term sustainability across all islands. We cannot expect the department to address our waste management challenges with outdated fleet or inadequate systems. Mr. Chair, I'll just talk a little bit about Cayman Brac. The Cayman Brac landfill currently operates without a landfill compactor. This is an essential piece of equipment for effective waste management on the sister islands. A compactor compresses incoming waste, maximizing the use of available space and extending the landfill's operational lifespan. Proper compaction also minimizes air voids within the waste mass, which is the primary method for preventing deep-seated landfill fires. Since the introduction of a BUMAG compactor on Grand Cayman, no deep-seated fires have occurred. As the Cayman Brac landfill continues to expand, the likelihood of such fires will increase without proper compaction. Procuring a landfill compactor for the Brac landfill will significantly reduce this risk. It will improve the safety on the site, and it will also ensure that more efficient landfill operations are provided for the sister islands. Mr. Chair, this plan will provide opportunities in our country for jobs in the energy and environment sector, economic diversification, and improve our national resilience. Colleagues, our country is calling on us to lead, not as separate ministries, not as opposing sides, but as one people with one purpose. The environmental health of our country affects all of us, and now we can all be a part of a real lasting solution. So let us work together to build these facilities, strengthen our communities, and secure the health of our islands so that the work we begin today endures for those who follow us. This is our chance to turn waste into worth and commitment into change. The environmental future of the Cayman Islands depends on what we choose to do together now. And I look forward to all of your support as we work to make the National Solid Waste Strategy a reality. Mr. Chair, another key capital project for 2026 to 2027 is within the Mosquito Research Control Unit. As we all know, effective mosquito control is incredibly important to our quality of life. And anybody who wasn't sure about it just had to ask themselves that a couple of weeks ago when our aircraft was down and the mosquitoes were going wild. It's not. And is directly related to the public health's ability to control diseases that can be spread by mosquitoes, such as dengue fever, chikungunya, malaria, and yellow fever. The MRCU, like so many of our departments, has done an excellent job with the resources that they have. But if we want to keep our country free of epidemic levels of mosquito-borne viruses, then we must invest in a new aircraft. The current mosquito control programs rely on a fleet of 2 aircraft that have exceeded their optimal service life, and the required maintenance is costly. This investment will strengthen our capacity to protect public health and control the presence and increase of mosquitoes. Mr. Chair, we're planning to invest $1,800,000 Cayman Islands dollars into the procurement of replacement aircraft singular, which will significantly improve operational safety, coverage efficiency, and responsiveness during peak mosquito seasons. Mr. Chair, as I close, I want to reaffirm this government's commitment to delivering thoughtful, evidence-based solutions to our challenges. Access to quality and affordable health care, clean air and water, and the preservation of our beaches and natural environments is not a privilege for the few. It is a right for every Caymanian and one that we are entrusted to protect. These are essential to building a society where people are healthy, empowered, and able to thrive at every age and stage of life. To the youth of our islands, which is why I am here, we hear you. Your voices matter, and we are taking action to support your future. As Maya Angelou reminds us, you have to act as if it were possible to radically transform the world, and you have to do it all the time, end quote. This budget reflects that belief. Together, we are creating a Cayman where everyone has the opportunity and support to thrive. Thank you, Mr. Chair.
Thank you very much, Minister. And with that, I open the question to HES1. Honourable Member Saunders for Borden Down West.
Thank you, Mr. Chairman. Almost tempted to say speak a while ago. As you know that I have an amendment here of a committee stage amendment which was filed actually exactly a week ago. And the amendment reads, in accordance with Standing Order 84.3 of the Parliament Standing Orders 2025, I, Christopher S. Saunders, elected member for Borden Down West, give notice to move the following amendment to the Appropriation Financial Years 26 and 27 Bill 2025. 1. That head HES1 be reduced by $1 for 2026 and $1 for 2027 in respect of policy advice and ministerial services to the Minister for Health, Environment, and Sustainability. Now, Mr. Chairman, I think we can all agree, based on the conversation that you, me, and the Premier had about a week ago, that what we wanted to achieve in this Finance Committee, we pretty much sent, or we pretty much achieved to some extent. For members present, I think everyone by now know what happened, but for the listening public, What happened was I was unhappy with the way we abruptly shut down the debate of the budget at the time, and I decided in good parliamentary fashion to exercise what I refer to as my last lick provision. For those of my niece and nephew, I don't lose last lick. And as such, I went through and I filed an amendment to reduce every ministerial budget of every minister that didn't speak by $1, just to back up the debate on their respective areas. And what we agreed was that each minister who didn't speak would do an opening statement to kind of outline what would have been outlined in the budget debate, because I thought that that was something that should have been done to begin with. So we sorted that out and we came to some understanding. And just to set the precedent, since it's already been opened up now, where I have in essence weaponized the amendment process of Parliament to some extent, I expect going forward that when we're doing second readings and so forth, that we'll get what we need to get done and avoid, I guess, playing politics or whatever, because this is serious business. Mr. Chairman, I recognize that this is also the last opening statement, and I want to also commend you for your patience and professionalism during this process. I know we all sit on different political sides, but at the end of the day, as you said, inside there may be three groups: the NCFS group, the official opposition of the PPM, and then the independent member on this side. And there are two sides, the government and opposition, but at the end of the day, there's only one key man, and that is what we're all working here for. With that said, Mr. Chairman, I want to thank the Minister for our outlining our policy statement and everything else and our plans for the ministry that she is constitutionally in charge of. I'm very happy to hear that there will be some focus on mental health. I was speaking to Dr. Lockhart just before we started, and one of the stigmas that we here in the Caribbean have been a little bit slow to deal with the issue of mental health. If you go back to the World Health Organization definition of health, which is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. It is that part of mental well-being, and that was a definition that came about since 1946. And for those in Europe and the Americas who were very active during that time, a year before 1946 would have been 1945, the end of the Second World War. And many of the people in that country or in those countries would have seen soldiers come back with PTSD and everything else and understand the importance of mental health. Thus the reason 79 years ago, that's an issue that could have been raised. We in the Caribbean, not being that active in the war theater, never really experienced a lot of people come back with PTSD and everything else. And as such, we never took it as serious as we should. We kind of put a little stigma to it, and we never gave it the importance that it is. So I am happy to see that Cayman is finally getting up to the world in recognizing that. And I think credit has to be given to even the Alex Panton Foundation and others who have really been working hard to make this thing, to push this issue forward. The Minister also mentioned a national plan, and of course, Mr. Chairman, you remember that the last time a national health plan was done was when you were in cabinet, and it was your colleague Mark Scotland that actually created such a plan. And I really have to recognize Mark Scotland because he has always been passionate about health, and it's something that he has continued to do even in his private life. So, Mark, if you're listening, I just want to say thank you for what you have done. And Mr. Chairman, the other thing I wanted to touch on, which the Minister kind of touched on in terms of putting together the national plan, is that when you look on the census that we did back in 2021, and you look at the top 3 illnesses, which is diabetes, arthritis, and cataract, and then you look at the global rate or the prevalence rate of these illnesses, you realize that Cayman is well above the global standard in that regard, which means that there's a lot of work to be done in that arena. And I'm happy that the minister is looking to address those issues and develop a national plan that will actually deal with it. But, Mr. Chairman, the last thing I want to touch on before we get into the other issues is the governance of the Health Service Authority. And I was not going to leave that out at all. And, Mr. Chairman, I want to start off by thanking you as a former director of the HSA and your team, other members who was on the board prior to 2021, started the just before the 2021 government took over. And a lot of people have basically been saying that I have made this issue a little bit political because of who the chairperson was. But I just want to put something in context, Mr. Chairman. I'm sure this is something that you're aware of already, but I'm just going to put it out there so the public can understand it. In 2020, the total board fees for the HSA was $82,215. And the profit for the HSA in 2020 was $1.2 million. In 2021, the HSA board fees for the directors was $192,550. And the HSA's profit was just under $8.1 million. So, in short, Mr. Chairman, if we were to look at 2020 and 21 and combine those together, the HSA had total profits of roughly $9.3 million and total board compensation of just under $275,000. Someone cannot expect me or anyone reasonable to go after anyone who produces $9.3 million in profit and $275,000 in fees, other than just to say thank you. And Mr. Chairman, since you're part of that board and other members, I want to thank you for your work that you did from back then. But then that was 2020 and 2021. In 2022, Mr. Chairman, the HSA's board fee was $250,900. And the HSA profit in 2022, actually there was no profit. It was a loss of almost $5.2 million. In 2023, Mr. Chairman, the HSA's board fees was $250,750. And the profit for 2023, actually there wasn't any. It was a loss of almost $7.1 million. And in 2024, Mr. Chairman, the HSA's board fees was $326,700. And the profit for 2024, none. Was actually a loss of just over $12.4 million. So, Mr. Speaker, Mr. Chairman, sorry, when you look at 2022, 2023, and 2024, the HSA had losses of $24.7 million and total board compensation in those 3 years of $828,350. Again, the 2 previous years had a profit of almost $9.3 million and less than $275,000, compared with $838,000 plus in fees and losses of almost $25 million. No one can expect us inside here as members of Parliament to ignore that kind of performance, to see the HSA go from $8 million in profit. And mark you, the year they had $8 million in profit, they were budgeting a loss of $12 million. It means that they beat their budget by more than $20 million in performance. So I don't think anyone can argue that the board back then and the management back then knew what they were doing. So when I see some people get up, and I won't say, oh, Osborne Bodden, that have the audacity and the temerity to attack the management of the HSA, people who by law cannot defend themselves politically from political attacks, I will do it. And when you get up and you talk about, oh, you're going to sue the member for Boddington West, if you take the time out to read this document, the Parliamentary Immunities, Powers and Privileges Act, I can legally say anything I want on this mic in this Parliament about anybody, call anybody name, and you can't sue me. period. So clearly, he didn't read the law either. So, but, you know, Mr. Chairman, we have been having a really good Finance Committee meeting thus far. We have a Public Accounts Committee coming up that will deal with these issues, deal with these directors who were getting paid more money in a month than they were meetings, and clearing over $12,000 and change a month, and showing up for cutting ribbons and showing up at staff meetings and all that kind of stuff. The Public Accounts Committee will deal with it, so we're not going to deal with it here. But I want to say to the minister, from a governance standpoint, and this is something that really needs to be dealt with, and I just want to close off by publicly thanking Ms. Lizette and her team at the HSA for the work that they have done and for remaining calm and professional despite all of this crap. You did not call those board meetings. You did not pay yourself all of that money. And all you did was look after your patients and look after your employees. And on behalf of the people that I represent in Bordentown West, I want to thank you and your team for the work that you have done, and I hope you continue to do it. With that, Mr. Chairman, I withdraw my amendment.
Thank you very much. I take it that the response to the minister's statement has been made, and I now open questions on HES 1.
Sorry.
Honorable Leader of the Opposition.
Sorry, I did want to, actually, you know, I'm happy to do, let me just check. I'm happy to do the questions under the headings if that's how you'd like to do it. Mr. Chairman, that's fine.
No, Leader, we've set a precedent, so if you have some specific questions on the statement, please proceed.
Sure, okay. Thank you, Mr. Chairman. Through you, I thank the Honourable Minister for the opening statement, and lots of encouraging information in there, as we've heard from other ministers as well. I'm sure that we'll get into some nitty-gritty with the different headings. But one thing that I saw was glaringly missing from your opening remarks that the Honourable Deputy Premier mentioned earlier was the beach renourishment or the beach erosion.
Honourable Minister.
Thank you, Mr. Chair. Through you, to answer your question, we haven't allocated any funding for the beach renourishment because let me finish what I was saying then, Mr. Chair. So that probably is a typo in terms of the description. What we have as a government agreed to is that the private landowners on the 7 Mile Beach landfront or waterfront have agreed to form a foundation company. They have already retained engineer, and they are working on developing the design for the construction of the replenishment. Where the government will fit in will be as it relates to dealing with the monitoring of the, well, first of all, reviewing and approving of the Coastal Works license or application, as well as from a tourism standpoint, it will be to work along with the foundation company as we talk about a funding mechanism for the future maintenance and upkeep of the beach renourishment. As of right now, what discussions have taken place with the cross-ministry approach, Ministry of Planning, Ministry of Tourism, and Ministry of Environment, is that they feel quite comfortable that they will be able to source the funds to replenish the sand.
Honorable Leader of the Opposition, continuing.
Thank you.
Mr. Chair, just for clarity, I think Leader of the Opposition, back to Mr. Bryan's question. Yes, this is a typographical error. This line item here is to deal with iguana culling, environmental research. When we get
to the line, we
I was just going to say, when we get to the line item, we can discuss it in its entirety.
Thank you to the Honourable Minister. And missed it in that split second that I. Thank you. I believe that the southern end of 7 Mile Beach is the only and will be the last the erosion of the coastline. As some sort, or we can continue to deal with these matters when they arise, as well as the maintenance of the affected areas on all 3 islands.
Honorable Minister.
We have, through you, Mr. Chair, we have had discussions amongst ourselves as government as it relates to some of the potential methods that could be used to provide funding, but that hasn't been a policy decision that the government has made at this time.
Honorable Leader of the Opposition, continuing.
Thank you. I would only say I would encourage that while the strike while the iron is hot, as they say, while people are willing to entertain it, because you never know, Minister, you fix the southern end, you don't know what that's going to create on the northern end. And there's other parts of the island that are seeing erosion as well, the 3 islands. Honourable Minister, gosh, lost that one quick as it came, huh? I will. I'll move on then. I did have another comment. And oh, sorry. Yes. Can Honourable Minister give us an update, if you can, on progress with the Marriott project, if they're moving ahead on their own?
Mr. Chair, if I can, through you.
Minister.
Yes, Mr. Leader, I can confirm that the Marriott has submitted a Coastal Works license or a Coastal Works application for the replenishment of the beach, and that has been successfully passed through Cabinet quite some time ago.
Honorable Leader of the Opposition, continuing.
Thank you. Moving on, Mr. Chairman, since there's the landfill, I want to speak to that a little bit. First, I want to ask, are you still satisfied with the timelines that have been given? Because I have to tell you, when I was in the government 5 years ago, they were telling us 5 to 7 years on the landfill. And as you rightfully noted there, that's when we were anticipating 80 tons versus the 124,000 tons that we're seeing now. Are you still confident that we have the ability and the time to go through this 10-year plan with the current landfill?
Honorable Minister.
Thank you, Mr. Chair. Through you. Yes, I am confident that hopefully with the rollout of our separate recycling facilities, starting with green waste, and as we start having discussions nationally, moving into more recycling at a or I should say, getting the country sensitized to recycling and diverting the recyclable items from the landfill, that yes, we will still meet the target that has been set out. However, I will say that we do have a contingency plan if that doesn't happen, as there's still spillover space on Site 4.
Honourable Leader of the Opposition, continuing.
Thank you to the Honourable Minister on that response. Also, Minister, I see where the objective, you said the objective is to build new processing facilities to adequately and safely manage these major categories of waste: commercial, landscaping, and residential. So we are creating new tipping sites, and if we are, where would the locations be?
Honourable Minister.
Thank you, Mr. Chair. That is correct. We will be creating new sites. We are still exploring the Crown-owned properties. As we all know, the facilities that are at the landfill have already benefited from an EIA, so we're hoping that we can utilize the space that is there. That is one of the options. And then, of course, we have the ability to look at other Crown-owned properties, as this really isn't residential garbage that we're talking about. We're talking about green waste, and we saw during post Tropical Storm Grace how that operated, where we had the separate depots that within each of the districts, residents were dropping off their green waste and it was being shredded. So we're still trying to determine the location, but one of the options is to do it. And just to, I guess, enlighten the public, as well as to share with those members who might not be aware, a part of the plan originally was to have these same said facilities set right at the location of the landfill.
Thank you. And yes, I know there was going to be vegetation and construction waste and that sort of stuff. What about the dirty stuff? The rotting food, the stinking stuff, the stuff we were going to burn. Where will that be going? The stuff that creates the flies and the smell across the West Bay Road, etc.
That is actually still being worked out. The first one that we are focusing on will be the green waste, and as we continue to do the policy and take it through caucus and cabinet and do each of the required investigations, then we will determine where. But I just want to clarify, are you talking about like garbage, or are you talking about the recyclable? Because the garbage will continue to go at the landfill site until we determine the new location for whatever the solution will be once we've conducted the 3-stage business case.
Honourable Leader of the Opposition, continuing.
Okay, thank you. And so I just want to make sure I get this right in my mind. So, because when you spoke here, you talked about next year and being able to start next year, but I assume then you're talking the strategy is to start separating the waste in order to slow down the amount that's going into the current landfill to give you enough time to carry out the 7 to 10 year plan. Am I understanding that?
Yeah. Honourable Minister.
Thank you. Yes, that's correct. Let me just clarify a little more, because I know I was reading a speech. So again, for the public to properly understand, the waste management solution that will replace the landfill is going to cost over $10 million, which means we will need to do a 3-stage business case. Just again to let the public know, that typically takes, as most of the members know, between 18 months to 2 years. So while that is being done by the ministry staff, we have taken the approach to work on separate facilities for the recycling component or the diversion component. And the reason why I said start as soon as next year is because we've already approved the policy guidance document through cabinet Now the team is working on the policy document. Once that's completed for those facilities, then we will do the individual business case and then start procurement for those separate entities, which we hope to be able to do. Hang on one second. Yes, I just wanted to make sure that I didn't misspeak. So we will be able to complete the policy and strategy in 2026 and then go into dealing with having the first facility started in 2026 with the aim to have that completed by 2027, which would be the green waste facility. And then like I say to my team, walk and chew gum at the same time. We'll also have to be working on the material recycling facility. One of the things that we've already determined is that the household waste recycling is going to be one that, as I mentioned in my speech, is going to take a bit longer for the public to get more accustomed to recycling. So we're going to focus on expanding the facility that is already there on site for recycling and then continue with those components. So I hope that that clarifies what I was saying in my speech.
Through you, Mr. Chairman. Thank you, Minister. I'm getting a better picture of it because I know that you talk about strategic business cases, outline business cases, procurement, RFPs, engaging contractors. I've never seen anything done in government without $2 million in a committee and 2 years. So I would be impressed if we could have a landfill, a new landfill in a year's time. So this sounds, it is still ambitious, but you have to be ambitious. Time is against us, as you said there. The component of recycling from the household, Minister, I am having difficulties and many of us, and possibly yourself and our constituencies in the more densely populated areas. I'm having trouble getting them to keep their garbage in a enclosure, in a bin, much less separate bins. In particular, with just picking up once a week, and so I understand eventually you will need, I guess, trucks with separate bins for the collection. Or separate trucks, but there's a lot of work, and it will take every single person in here as representatives. We will take some licks. I can tell you that we will take some licks in our constituencies trying to get persons to conform to separating their trash, putting it out on the right days, et cetera, et cetera. Like I said, I have trouble getting them to keep it in a sometimes they have to go out and buy them enclosures or bins to keep the garbage in. So I offer you my full support as long as we continue to be informed and we understand the transparency, the trust issue, and once we take out the politics of it, because this is a national issue. It is a real issue for us all. And nobody else wants it in their backyards. Unfortunately, it's literally in my backyard. But no one else wants it in their backyard. It's in my constituency. I just wanted to, sorry, on the landfill? Sure.
Mr. Chairman, I want to say, yeah.
Before you do, Mr. Chair, may I have permission to just respond to the comment that the leader has made about the waste receptacles?
Honorable Minister.
Just to say that this is something that I've been discussing with Director Sims and his team. I heard it earlier through the debate where some members were talking about the concerns of rodents. Many of us really dislike to see the condition that it looks when a dog or chickens get at trash. And so as we move towards an independent or standalone legislation, which I'm working on, and actually the draft and instructions have already gone to the legal drafting team, we will be looking at those sort of requirements. And of course, it would be something that we'd have to look at how we roll that out, because there are certain areas where persons simply just can't afford a garbage container. Yes, but it's something that we need to have on the radar, and we will be looking at that in the future.
Mr. Chairman, I just want to make a
Member
proposal.
for Georgetown Central.
Thank you, Mr. Chairman. I want to thank my honorable leader for giving leeway here. One thing I think we're recognizing here that, and I'm so happy that the leader highlighted the fact that you're doing the groundwork for a fundamental, proper approach to this. But what I'm worried about is that it does take a long time for us to do this. And I'm really worried about what my leader just highlighted, which is trying our endeavor best to leave politics out of this. And I'm wondering if this is the appropriate time for us all to agree to have a bipartisan committee led by yourself, that no matter what happens, whenever it happens in elections, that we all agree on the same approach, that it doesn't get stopped or stalled, because it's going to take a long time. And I don't know if the government is willing to do that. I know my leader has said something like this similarly, but we need to resolve this once and for all, and don't be at the risk of an election, that we have a solution for waste. So I don't know if the minister or the government will entertain such a thing.
Mr. Chair, if I might respond,
Honorable Minister.
just to say that this is the approach that this administration does intend to take, and it is an area that I had planned to reach out, especially as Mr. Hughes said, I'm quite aware it's in his backyard. But yes, I think with a lot of the long-term plans that we see, we need to ensure that there's continuity, and so the plans can continue. So certainly I'm happy to, and actually it's a conversation that we'd been having on having a more collective approach with some of these larger projects.
HES 1.
Sorry, Mr. Chairman. I was still.
Oh,
I had just
Honorable
given
Leader of the
to-
Opposition.
Yeah. Two things. I'll give you both, and then you can answer those, and I think I'll be able to move on from the landfill and from your statement. Would you mind giving us an update on the tire removal? Because if you were just feeling the mosquitoes when the plane broke down, I've been feeling the mosquitoes for about 3 or 4 months continuously, even when the plane was flying. And we know that the tires and other things on the landfill are large contributors to the reproduction of the mosquitoes. Can you give us an update on how that procurement process is going? I know this is probably the second or third attempt at it. And the second aspect was, you have heard my appeal for an oversight committee, body, whatever, to landfill. Have you?
Honorable Minister.
Thank you, Mr. Chair. I'll start with the procurement for the metal or scrap metal. Sorry, in Cayman. This is the removal of, as well as double checked just to give an update, because I suspected it would be something members would be interested in knowing, and a contract, the procurement completed, and we hope awarded, the contract will be awarded.
Through you, Mr. Chairman, that is fantastic news. And let's hope that we get all of the other government entities in line. Speak openly about things like the port. Understanding that the important thing is to get rid of this garbage, not to make money from getting rid of it. I struggle to understand this idea that dealing with the largest environmental crisis that this country faces and has faced is that you want value for money in doing it. If we can get it out of here, let's pay to get it out of here. That's my feelings. So thank you for that, Honourable Minister. And thank you for being open in your answers. I appreciate it. Thank you.
No problem. Mr. Chair, sorry, I even though I wrote it down, I still didn't answer your second question about the Oversight Committee. Just to say that when I was working on the project during the previous term, I know that a lot of the findings that came from the EIA report referred to needing to have mechanisms in place for air quality control. And as we move into having legislation, which I'm hoping that as we work towards having a new landfill or a new waste and recycling solution, that we will also have standalone legislation to govern that. But certainly, even if it isn't legally required, I would not shy away from having an oversight committee.
Thank you, Minister. And just to say that this is nothing against the DEH either, because I think it'll actually be helpful. Because when we talk, you spoke about the compactor. If there was an oversight, a regulatory authority, an oversight board monitoring the landfill, they would have had that independent report saying, we need these compactors. They would also have that independent report coming to you or to the government of the day saying, we need the budget for X amount of material to do the capping, to do the, every 24, 48, once a week, whatever is needed in Cayman. And it just creates that check and balance for the Department of Environmental Health and the government so that there's transparency and there's no finger pointing when something goes wrong to say, I wanted it in the budget, but they wouldn't give it to me or they didn't ask for it in the budget. So I think it's too big of a, I want to say crisis, but I do believe that it requires some oversight that ensures that both sides, the government, the elected government, and the Department of Environmental Health are being held accountable and are on the same page.
Mr. Tatum, member for MP for Red Bay.
Thank you, Mr. Chair. Mr. Chair, I'll start with mental health, page 6 and 7 of the report. The members might recall during the strategic policy statement, I had mentioned that I wasn't seeing anything specific about it, about youth mental health and a youth mental health facility. So I was imploring the government to make sure that was included. I'm happy to see that that is here, sir. And I said to the minister, I'm also extremely happy to see the other things that will be there. The 4-bed facility, as well as a mobile unit. But could the minister please say when she's expecting that 4-bed facility to be ready and up and running?
Honourable Minister.
Thank you, member, for your question. We've been busy talking about the works, and I know that we were dealing with planning. We were waiting on some approvals from planning. But before I misspeak, I want to just double check that that is still the case with the team. Can you just give me 1 minute?
Okay, 1 second.
That is the case. The application is with the planning department now, and subject to planning approval, we are hoping to have it completed before the end of next year.
Mr. Tatum.
Mr. Chair, thank you. And the location of the facility?
Honourable Minister.
Mr. Chair, we looked at a number of locations in the hospital, and the location that was easiest to transition was near the women's health area and the pediatrics. And what will happen is that the pediatrics unit will be relocated to upstairs, which has now been retrofitted for a, I guess you could say, sort of a. Let me just double check that things haven't changed, but I'm still in good shape, still the same. It was just important to note that the reason why this location was best suited is because it's right adjacent to the mental health ward.
Mr. Tatum, continuing.
Thank you, Mr. Chair. I agree with that. I think the location is probably a good one for that, what I would call a temporary facility. Another more, on the longer-term facility, the same two questions. When do you anticipate the start of that and the completion of it? I'm assuming that what we have in the budget is only the bits for the plans and so on.
Honorable Minister.
Thank you. As we get through the line item, it shows where we don't have anything budgeted for 2026 because we're looking at, again, going back through the whole three-stage business case. So we're looking at starting construction in 2027.
Mr. Tatum, continuing.
Thank you, sir. So what's in there now is mostly to get through the business case part of it. And plans?
Honorable Minister.
Sorry, Mr. Chair. When we get to that line item, we can go back through it in its entirety, but if my memory serves me well, we don't have anything budgeted for 2026. The capital is set aside for 2027, which is when we plan to start construction. As it relates to the services that you were just mentioning, that would go under professional fees, not capital.
Mr. Tatum, continuing.
Thank you for that. Looking at page 7, the Minister wrote here that I can speak more expansively on the future plans of the facility, that's the Ponciana Rehabilitation Center, when we get to the output appropriation. Do you want to do that now, or you want to do that later?
Honorable Minister.
Mr. Chair, if it's okay, I'd like to leave it till when we're with the
fine.
location, because the appropriation. So I'm sure there are going to be other questions that will come up at that time. I'm excited, though, I'll tell you.
Mr.
Tatum, you shouldn't curb the minister's enthusiasm. Do we go to the put?
I'm far from doing that, sir.
Mr. Tatum, continuing.
Thank you, sir. The landfill. Minister, I want to take my hat off to the folks at the DH. It's a hugely important role that they perform, often underappreciated. So I want to just take a moment to thank them for it and to say they have my utmost thanks and appreciation and respect. So I'll use that as a jumping off point then. In terms of the new facilities for the recycling, if it was said, I missed it. If you want to discuss it later on. Well, was the question asked earlier as to where those facilities would be located? Actually, I think I'm recalling some would be at the current landfill, I think, and the others would need to be. You need to find places for the others, correct? Right. Kimmelbrack landfill. Just want to make sure the metals. No, not Red Bay. It's Kimmelbrack. The metals that are there, will they be shipped, will they be baled and shipped to Grand Cayman to be shipped off from here, or exactly how would that be? I think I may be wrong, but is there a baler there? Okay.
Honorable Minister.
Mr. Chair, if you can just give me a minute, I want to confirm with Director Sims if they're going to be baled. I know for sure they're going to be shipped, but I want to confirm. Give me 1 minute, please.
Thank you. Yeah, otherwise.
Thank you, Mr. Chair. The medals will, once the contract is awarded tomorrow, what the contract encompasses is that the medals will actually be shipped. There will not be any bailing taking place in the BRAC. They'll just be shipped off. And I will say that I was really happy to go personally with Director Sims and see for myself, which is how I could appreciate the fact that it needed to be dealt with urgently, because it's quite high. Equally the tires as well. So I'm happy that that contract will be awarded tomorrow.
Mr. Tatum.
I will end here. I will, Minister, thank you. I thank Mr. Sims as well. The one other point I'll make is that I'm extremely happy to see that the new Pharmacy Act with the regs will come in, I think you said in 2024. That's long overdue, so I just leave it at that.
Honorable Minister.
Thank you, Mr. Chair. I want to clarify that the Pharmacy Act was already passed. It just hasn't commenced as yet. Oh, okay. All right. Just wanted to clarify.
Members, we would then turn our attentions to the appropriation groups to the Honorable Minister, and we begin with HES 1, Policy Advice and Ministerial Services to the Minister for Health, Environment and Sustainability. Are there any questions? Mr. Saunders, MP for Bordentown West.
Thank you, Mr. Chairman. Through you, Mr. Chairman, to the Honourable Minister, what is the government's policy on the culling of cats?
Minister.
Mr. Chair, every time I hear anything about cats, I think about Minister Jay's missing pet. Just to say that the culling of the cats, 1 minute. Mr. Chair, to answer the member's question, there are different methods in which the cats are euthanized. They're euthanized by total anesthesia followed by lethal injection, or precise transcranial shot administered by a licensed rifle operator, or chemically induced hypoxia.
Sorry, go back to that rifle one for me. That's the one I'm interested in.
Member for Bordentown West, I figured that might have caught your attention.
Yes, Mr. Chair.
Mr. Chairman, no, I have a strong community in Beach Bay that actually feeds a lot of these cats, and I have a lot of constituents who are pet lovers and pet owners. And so, through you, Mr. Chairman, to the Honourable Minister, that third option of using a gun, where did that option come from? Where did that recommendation come from?
Mr. Chair, let me just clarify that
Honourable Minister.
Thank you, through you. That option is not used in Beach Bay. That option is used in instances on the BRAC, on the Bluff, or in some instances in Little Cayman. And I hear you about your residents and your constituents not being happy about hearing of anything being shot. I myself cringe at the idea of any living creature being shot. But after your question the other day, I started to speak to my team, speak to the director of DOE, and I have determined that this is not an uncommon practice. It's the same way that we deal with our cows when we're ready to get them ready for Christmas beef, or when we were to deal with the turtles. I wasn't aware of that. So the scientific evidence that has been used to determine this process sets out that this is the most humane way to deal with euthanizing an animal. However, since you asked the question, I think we need to look at why are we needing to euthanize animals. And what I'm pleased to share is that many members that I work with on the government side have been very passionate about advocating against animal cruelty. So we've been having discussions about the Animals Act, and Minister Jay, as many of you heard, Minister Ebanks, earlier this week, he got his budget approved, which approved for £2 for cat pounds. So once we can get to the place of having pounds, then that removes the need for having to look at euthanization in this fashion.
Thank you very much.
Minister, the member did ask one other part of the question.
Thank you, Mr. Chairman.
Sorry, well, I was so busy.
Yes, I know that this is a very emotive topic for a lot of cat lovers in this chamber. And he did say, where did it come from?
Well, for the record, I'm no cat lover. But I certainly didn't like the idea when I first heard about it until I became aware that this is the process in which it's done. To answer your question, the decision was made by the National Conservation Council as they are charged with the conservation and protection of endangered species in accordance with the Constitution and their Act.
Member from Bordentown West, do you need a minute to compose yourself?
Mr. Chairman, I am just trying to, from what I understand, they're having these cats in a cage, helpless, and then being shot. It's one thing we're doing something to feed. I mean, I don't eat cat at Christmas, so versus Christmas beef is two different things. You know what I mean? And I'm not getting into that debate, but the scariest part for me, Mr. Chairman, through you to the minister, is these types of recommendations and where they're coming from. I mean, the very name says conservation, preservation, and now we're talking about elimination. You know what? I'll leave this alone. Somebody else can take this. I'll leave this alone.
Lady member from Cayman Brack East.
Thank you, Mr. Chair. I wonder if the Honourable Minister could satisfy my curiosity as to who the legal perpetrators of the euthanism of the Brack cats are. Is it under contract? Is it done by the department itself?
Honourable Minister.
Mr. Chair, can I just ask for a moment to confer with my team?
I come into that.
Thank you, Mr. Chair. It is conducted by DOE staff who have been trained and licensed.
Honourable member continuing.
Mr. Chair, can the Honourable Minister direct me or confirm as to whether there are enough funds in this budget for the purchasing of rifles by DOE?
Honourable Minister.
Mr. Chair, I need another minute, please. That's not something that we discussed. I just need to confirm. I've been reliably informed that there's nothing in this budget relating to the purchasing of guns.
Thank goodness. Honorable member continuing.
Just to be absolutely clear, has any funds been used from the 2024-25 budget for the acquisition of these additional rifles? And what type?
Honorable Minister.
I need another minute, please, Mr. Chair. Mr. Chair, I have been advised that there have been funds used to purchase air rifles, but this would have been in previous budgets. And it's air rifles that are designed to deliver instantaneous, painless execution.
Mr. Chair, can the Honourable Minister say when was the last time, if any time at all, that members of the DOE staff have been trained by the gun club?
Honorable Minister.
Mr. Chair, I've been advised that the staff was trained many years ago. We would have to seek confirmation to determine if there's been any recurrent training.
Thank you, Mr.
Honorable
Chair.
member continuing.
And in light of the fact of the very detailed presentation that my lady member, Minister from Westby, have done, I will phrase my final question in this regard as follows. When you're seeking that information, ask the relevant team whether 22 rifles ring a bell. I'll speak to you offline.
Member from Bordentown West.
Just switching gears away from the murdering of cats, Mr. Chairman. Through you, Mr. Chairman, to the Honourable Minister, where are we with the spirit gun license? That was one of the things that had passed in this, a couple of motions already I can recall that dealt with this issue.
Honorable Minister.
Mr. Chair, again, I just need to refer to the Director for a quick moment. Thank you. Thank you, Mr. Chair. Through you, I will say to the member that it's just a matter that needs to be taken back to Cabinet for reconsideration under this new administration.
Member continuing.
Just so we're clear, maybe I should have said this first. What is the government's policy, the current government's policy, with regards to the issuance of spirit gun license?
Honorable Minister.
I need to just stay standing. Just give me a minute, please. Mr. Chair, through you, the current position right now is that renewals are being granted. However, no new applications have been approved, are being approved.
Member from Bordentown West, continuing.
Mr. Chairman, so in short, there is no government policy then in terms of granting new spray gun license. I just want to understand that.
Honorable Minister.
There is a process. Just give me 1 minute to confer. Mr. Chair, through you, I've been advised that there was legal advice from the Attorney General's chambers, which is about to be submitted to the Department of Environment. It's with the ministry right now. And once that has been sent to DOE, then it will be sent to the National Conservation Council for them to implement.
Honorable member, continuing.
Mr. Chairman, I am sure you're familiar with Section 44(3) of the Constitution that deals with policy. And other members inside here who are members of Cabinet, who have been members of Cabinet, understands the Constitution, Section 44(3). I will leave that as is, and the Premier isn't in chamber, but I will discuss it with the Premier when he arrives back in chamber. I'll leave off on this issue.
Honorable Minister.
Mr. Chair, I just want to clarify that Minister Jay has been in discussions with me, and it's one of the areas where we need to ensure that we have some sort of regulations or some sort of clear guidelines to the public on how and which applications can be processed. So the advice that has been received from the Attorney General's chambers, I will have a look at that, and then we will determine how to move forward.
The most important part, through Mr. Chairman to the Honourable Minister, the most important part starts with the government's position, the government's policy position. If it's a yes, then you do what you need to do to make it happen. Or if it's a no, then it's dead. So if the policy is that the government is going to start having license reissued, then that's fine. But what we can't, I mean, that's what we're just looking for, and that's why we said the government's policy. It's not anything to do with DOE, the National Conservation Council, nothing. It is the government's policy. And the Constitution is clear that that is the remit of Cabinet and Cabinet alone. So there's nothing to confer. So if the government is either going to move forward with it or not going to move forward with it. Now, the process afterwards is a different thing. It's just a yes or no. Is the government going to move forward or not move forward?
Honorable Minister.
Mr. Chair, thank you, member. That's a good point to make. And what I can say is that I haven't brought a paper to Cabinet or caucus to discuss it with members to ensure that this is a policy position that the members want to take in terms of what the position would be on the spare gun license. And I certainly know how Minister Jay feels, but we would need to take it to caucus to determine the government's policy position and then move it forward.
Just thank you very much for that, Minister. Just as a note of explanation, barring the Minister for Home Affairs, the Minister for Cayman and Employment and Immigration, and the Deputy Premier, just about, and the Minister of Finance, but I know he supports it because he has to, he's a West Bayer. Barring that,
True.
I think every other single member of government was a part of this last Parliament where it passed unanimously for us to move forward. So I would think, I mean, unless the new guys or the new ministers, and we know the Minister of Finance supports it, and I know I know the Minister for Home Affairs would support it, and I know the Minister for Cayman and Employment would support it. I think we have support to move forward.
Mr. Chair, it would be very irresponsible for me to say the government's policy position without ensuring that all of the members are on the same page. Now, I would imagine that we might be, but I'm not going to publicly say that today without knowing for sure. I might get myself in some trouble.
No. Okay, that's fine. Okay, through you, Mr. Chairman, to the Honourable Minister, what is your position on it?
Honourable Minister.
I'm a saltwater girl. What do you think?
All right, that's all I need to know. That's good enough for me.
Mr. Chairman, can I just quickly ask the Honourable Minister to refine or define what I'm a saltwater girl means? So I don't know what that means.
Honourable Minister.
Is that you support the spare gun license or not? Here, Mr. Chairman, I think you need to answer it, Minister. I apologize.
Honourable Minister.
Mr. Chair, through you, I don't have an issue with the spare gun license, with issuing the spare gun license. However, one of the reckless things to do is to sit in Parliament and say a personal position when you work and represent a government. So perhaps I should have said, I will withhold my position until I have liaised with my colleagues. But I'm not afraid to say that today. What I will say to the members is it's risky business. The last time that I was with someone with a spare gun, we got chased by a shark. That was my beloved father.
Thank you so much, Minister, for giving a little bit more clarity. Mr. Chairman, I think that we're avoiding some undercurrents that we all know is happening, and I'm so tired of it, to be honest with you. There's an internal battle within the political viewpoint on this matter and the difference in viewpoint with the Department of Environment. There's bodies in there that do not support this, and they're doing everything they can to stop the process from happening over and over again. We've been going through the spare gun license thing from when I was first elected when I was in opposition the first time. But if they were, hold on for a second, Minister, apologize. But if they want to murder cats, they don't need no policy directive for that. Mr. Chairman, this is the House of Parliament. The people elected the 19 members in here to carry out, and we all agreed with it. The member here, now the minister, voted for that before. We got to stop doing this. Technocrats cannot control the people's will. We are the people's will. The people sent us here to deliver. Now, Madam Minister, you notice I have been teasing you all week about questions. I'm not troubling you, right? I'm not troubling you. And I ask you no pilot questions because you're my friend. You know that. But we got to stop this. You either are going to deliver on the spare gun license or tell this country you're not going to do it. And the reason why you don't want to do that, because you know many Caymanians want the spare gun license. But the people behind the scenes are dictating whether we should have it or not. That's not fair. Can you put a timeline on when this is going to be resolved, please?
Mr. Chair, through
Honourable
you,
Minister.
I'm sorry to disappoint the member that what you're imagining in your mind, this contention that you think exists on this government bench, is not what you have pictured. The discussion as it relates to spare gun license has not been a priority to date. Why? Because we've been dealing with budget, we've been focusing on the other matters. Of course, it's something that we're going to discuss. Certainly, it would be in my best interest to advocate for it, as I just said. And everybody knows that the constituency of West Bay Central is built with water sports operators. But I'm not going to sit here today and tell you a policy position that has not yet been discussed with this administration.
Member for Bordentown West.
Mr. Chairman, I owe the Honourable Minister an apology, and I owe this Parliament an apology, and I owe everyone listening an apology. I was asking about the government's policy. and I completely forgot that there is already a law that says it should be done. It is section 5, it's on the part 2 of the National Conservation Council License Permit Directives 2022 revision, and part 2 of that deals with the license of spear gun. I apologize, Mr. Chairman, I raised up an issue that should not have been an issue. The question should have been, how many spear gun licenses have been issued as per the law? So that's my question, because the law is actually there. It actually is already there. As I do apologize.
Honorable Minister.
Mr. Chair, I thank the member for his question that was asked earlier. We haven't, I've been informed by the director that there are no new licenses issued. They've been issuing only renewals at this stage.
Okay, thank you very much, Mr. Chairman. Mr. Chairman, to the Honorable Minister, and under what section of the law is being used to deny people the right to apply for, deny people a Cayman that meets the criteria as required by the law to be approved for a spear gun license?
Honorable Minister.
Mr. Chair, through you, I've been advised that there is a provision in the law that sets out that the cabinet would determine the procedures or the process as the law isn't prescriptive to that, and that is the reason why it hasn't progressed.
Honorable Member Bordentown West.
Mr. Chairman, you can ask a question, because the look on your face, you want to ask the same question too. So I will allow you, I will give way to you, Mr. Chairman, to ask the relevant question.
The chairman has been doing a good job so far.
Of staying out of the mix.
And I have stayed completely out of this stuff, and members have every right to ask their questions. I've been very lenient in my leeway, so please proceed.
Mr. Chair, through you. I think that the safest response at this stage is to say that Cabinet just needs to deliberate on the provisions that have been put forward so that we can get that implemented and then the applications can start to be processed.
Member from Bordentown West, continuing.
Mr. Chairman, I am at a loss of words, so I'll just leave it at that.
Member for Georgetown Central.
Mr. Chairman, I have a concern in my neighborhood. This one, I guess, I don't know if I'm, for the people that live on the road I live on, I don't want to talk about it from a perspective of murdering cats, because I would hate to think that that is happening. But there is, can you tell the listening public, for those who are listening, how to resolve cats that are stray in their neighborhoods and that process? Because I've had complaints in my neighborhood as well.
Honorable Minister.
Mr. Chair, we are not, I've been advised that we are not culling cats in Grand Cayman.
Oh, okay.
Member for Georgetown
So,
Central, continuing.
Mr. Chairman, if my spot pay MP 50% off would give me way,
Lady member from
is there an
Cameron Brack
overriding reason why we're doing it in Cameron Brack and Little Cayman? Because the member from Bordentown West, I think, had a lot of IO-ins. I could also ask discrimination. Everybody seemed to have a right these days under the Constitution. Because I can tell you it's an issue. And I know Little Cayman started about iguanas and stuff like that there, but what's the issue in the Brack? Because chickens are a much bigger issue up there than cats.
Mr. Chair, through you, the reason why it's not being done in Grand Cayman is because presently there is a judicial review which prevents it from the culling from taking place in Grand Cayman. And the reason why they're continuing to do it in Cameron Brack and Little Cayman is because the feral cats are eradicating the protected species such as the boobies.
Isn't it, through you, Mr. Chair, and I'll turn back to MP Bryan, is the minister in a position with the help of her attending staff to say approximately how many cats have been given the exit order?
Mr. Chair, can I have a moment to confer with my team, please? I think I might have that here, but I just want to double check.
Okay. You could provide it in writing.
Mr. Chair, through you, I've been reliably informed that 209 in Little Cayman in total and 49 in Cameron Brack total. And that is not just for this year, that is since this process has started.
All I can say, Mr. Chairman, where the 49 was Cameron Brack? Where the 49 was in Cameron Brack, there must have been some very, very hungry cats based on a justification why we're killing them?
No,
Mr. Chairman,
Member for Georgetown Centre.
Thank you, sir. I have two questions. I'm going to get to another animal shortly, but I'm confused. You're saying that our judicial system is saying to us that you're allowed to do the culling in Cayman Brac, but you're not allowed to do it in Grand Cayman?
Honourable Minister.
that's correct.
On what basis?
Just let me confirm with the team.
That can't be right.
Mr. Chair, through you, there was an undertaking made that the culling, I couldn't remember the name, culling of the cats in Grand Cayman would not take place until the completion of the animal pound, which is, and we are on the process of having the animal pound, what was it called, order, approved by cabinet. And once that's done, then hopefully we can establish the cat pound. However, the reason why they've been allowed to continue in Cayman Brac and Little Cayman is from a protection or conservation perspective where, as I mentioned earlier, it's in relation to the protection of the endangered species birds.
Lady member from Cayman Brac.
Thank you, Mr. Chair. I thought that was my last one, but is there another colony of boobies except on the bluff, Cayman Brac, which the highest in at Spot Bay? I can see Little Cayman.
Honourable Minister.
Thank you, Mr. Chair. Apparently, they also nest on the beach below the bluff.
Honourable member for Cayman Brac East. Honourable member for Georgetown Central. Do we have a lot more?
No. I just going to
I
ask
think we've
them.
exhausted the cats.
Yeah. I'm going to just ask the minister to, if she's willing to provide for members the directives on their authority to call, so we can see it in writing, because I'm challenged as to how that can be a legal directive. But I'm not a lawyer, so I'm going to assume you're right. But can we have it sent to us in writing so I can see, not today, but at another time, based on the advice you were given?
Yeah, through you, Mr. Chair. Yes, I certainly can. It was done publicly with the recent meeting of the NCC, but I will commit to providing that in writing.
But just to be clear, you're saying that the courts said that you could not do the culling in Grand Cayman, but the grounds upon which you were allowed to continue to cull in Cayman Brac and Little Cayman was on the basis of protection of a endangered species.
Mr. Chair, through you, is getting a bit convoluted in my mind. Can I ask the member if he can please repeat what exactly he wants me to commit to providing in writing?
I think we covered that part. You said you provide in writing your.
Can you please commit? Can you please repeat what exactly? I want to make sure that I provide the right information to you.
Okay. The authority upon which the courts have directed your department to continue to operate in one or two islands, but not in the other two. And I just want, sorry? In two, but not in one, particularly being Little Cayman and Cayman Brac, you're allowed to continue to cull, and Grand Cayman, you're not. So the directive or the ruling or the hearing, I just want to see it for myself, if that's okay.
Honourable Minister.
Thank you, Mr. Chair. I can commit to that, and I am happy that the member repeated what he was requesting, because that's not what I first understood you were asking for. So thank you.
But for clarity, that's what you were saying, right? That is the case from your advice?
Yes, that's what I've been advised, so I'll get that provided to this committee.
Thank you. All right, moving on, Mr. Chairman. Can the Honourable Minister say whether or not we're going to remove the $500,000 fine for feeding chickens? Which I admit that I was a part of that government that implemented that fine if you were caught feeding chickens after, I think it was a third time infraction, up to $500,000.
Honourable Minister.
For feeding chickens, yeah, I think.
Mr. Chair, through you, the member took me back down memory lane because I forgot about the whole chicken fiesta myself. What the director has reminded me is that what you're referring to as it relates to the $1 million fine is just the maximum penalty that is set out in the National Conservation Act, but it isn't anything specific to the chickens.
Well, what is it specific to then?
Honourable Minister.
It's just the penalty for any infraction for individuals who fail to comply with the Act. You can be fined up to $1 million. Sorry, $500,000, but we can fine $1 million if you want them to. We can change that.
Okay, and that's any infractions upon the National Conservation Act, correct?
That's correct.
Okay, so technically a person could be charged $500,000 for feeding chickens.
This matter would be taken to court, and it would be left for a judge to determine if that would be a reasonable charge to charge someone $1 million for feeding chickens.
Okay. All right. May I suggest that that infraction don't cover feeding chickens? I think it's kind of unsensical to have that. I mean, I think most of us, in all honesty, Minister, you remember the fiasco you just said took you down memory lane. We were laughed at in the media for it. I don't think that, obviously that's not the intention. I don't think that's what we wanted, but it sounds illogical. So maybe consider amendments to that or separate categories for separate different infractions. I mean, you have worse criminal offenses in the country that don't amount to $500,000, right? So I just ask you to look into it. Thank you. Thank you, Mr. Chair.
Thank you. HES 1. HES 1. Member for Georgetown West.
Mr. Chair, thank you. Mr. Chair, through you, I'm glad we're over that cat discussion. Mr. Chair, with the ongoing community complaints with delayed garbage, can the minister identify whether this budget increase DH staffing or from an operational standpoint to take care of the delayed garbage?
Honourable Minister.
I can almost confidently answer that question, but I'm going to just call on the amazing director for DEH if he can just come to the side so I can speak to him for a minute.
What range of,
Minister Costa.
Minister, he's opposition.
Minister DaCosta.
What range of questions do you all have on the other outputs groups? Free range?
Mr. Chair, through you, I just wanted to double check with Director Sims, and he did confirm that the delays, if any, which we really haven't been having a lot of delays recently. Sometimes we'll get a complaint that a garbage truck has not come by the home, only to find out that those individuals may have forgotten to put their garbage out earlier and they missed the garbage truck. And when that does happen, they still circle back around at a later time to pick up the garbage. However, there are occasions where, typical with equipment that is being used frequently, you might have a truck that's down here or there, but we're confident with the budget that we have that we can continue to operate on a timely manner.
Thank you very much, Minister. Member for Georgetown Central.
Minister, can you tell me if public supposed to have their garbage cans on the main road? What does the law say to that? Because you have a lot of people who, they put the garbage frames outside of their fence onto the road, and then you start to see as you're driving down the road, that you see these bins kind of outside on the road. I don't know what the law says to that, because most other places will do a little indentation at the front of your yard. So what is the rules on that?
I'm so glad.
Minister.
Sorry, Mr. Chair. Through you. So glad you asked that question. I touched on it a little earlier, just to say that in the absence of having standalone legislation for DEH, right now we're relying on the Public Health Act, which is what touches on, I guess, where DEH has their governing legislation. So once we have this standalone legislation, then we can start looking at maybe further requirements. What I can say is that having spent time as minister speaking with the director, it is a concern of mine because I certainly don't want to see Cayman Brac, or Little Cayman infested with rodents. And that happens when the garbage isn't put out properly. We all know that we have dogs and chickens and cats that will sometimes pull the garbage over. It doesn't look good. It isn't appealing. And then from a safety standpoint, as it relates to the safety of the staff of DEH, we have a lot of injuries from our waste operators who go to pick up the garbage, and sometimes they're very heavy, so they injure their backs. Sometimes they have to go into the properties to take the garbage out. It's wet, they slip, they fall. So certainly there needs to be a national position taken at a later date on how we store garbage before it's collected. It is a practice that we see throughout many countries. Cayman is a very rich country. I think we're all proud of, the robust infrastructure that we have. And so it really shouldn't be anything to be ashamed of as a minister to say that, yes, I want to see us disposing of our garbage in a certain fashion. So it's something that we're going to look at. But before we get to a place of a requirement, we'll start to talk to the public. We'll encourage members of the public to go out and purchase certain equipment. as it relates to the storage containers. It is one of the things that we've also looked at with the department in terms of trying to roll it out to the public. But right now, our focus is on addressing how we deal with the disposed waste first, and then from there, we can look at the storage and containers and so forth. But it is something on the radar, Mr. Bryan.
Thank you, Minister. Through you, Mr. Chairman.
For Georgetown Central, continuing.
So there's not a law right now that specifies where you can put your garbage? I know you can't put it on the road.
Honourable Minister.
Thank you, Mr. Chair. I stand corrected. Our amazing director, who is celebrating his 35th anniversary today as a civil servant, has just advised me, yes. Congratulations, Mr. Sims. That's a very long time to be embedded to the civil service, so we appreciate you. Say again? What Director Sims advised is that there is standalone regulations that speaks to how a resident should bring their garbage out, that you should bring it out, and that you should remove the storage container and store it back in your property. But it doesn't say how you should display it. I'm trying to think of how to, it doesn't say how you should store it for it to be collected by the operators. So the responsibility on the homeowner is that you should put your garbage out, not expect the garbage collectors to go and take it from your property. You're responsible to put the container back once it has been collected by the garbage operators, and you're also responsible to keep your driveway clear.
Okay. Thank you, Mr. Chairman. I'm going to ask the Honourable Minister if she would allow for the Director to give answers, because I now have a lot more further questions about this area. And rather than going back and forth, it would probably be helpful.
Yes, certainly. I don't have a problem, and I'm sure he doesn't either.
I know. He's a pretty awesome dude. Mr. Sims, good evening. I heard the Honourable Minister give a description of what the rules say, where they should be. Maybe you can give a better narrative. As you know, the formalities, introduce yourself and your position before you speak.
Richard Sims, Director of the Department of Environmental Health. Through you, Mr. Chair, the garbage disposal regulation does provide for how persons should put out their waste. What it says is that you are to put out your waste the night before the scheduled collection. And once the collection is done, you are responsible for taking up your bin and put it back. But I try to encourage my team as a professional courtesy to replace the bins when they're, but the regulation put the onus squarely on the property owner. And in terms of your question in relation to the clear passage, there should be no enclosure fixed on the roadway. It should be fixed on the properties.
Oh, thank you. I think that was to the heart of the question I was going to trying to get to, because I see in circumstances where a person will have their gate out front, but they have their fixed garbage containers, not the containers as in the garbage can, but like a square box where they put the garbage cans in, literally outside of their property, and it stays there all the time. So I'm asking if that's legal, because what it is it's outside of their property line, which is now into the roads authority property. Is that legal?
Through you, Mr. Chair, absolutely, that's not legal. You know, because they're actually putting stuff in the roadway. Where, matter of fact, my team, I have been the environmental health officers. Have been instructed to look at enclosures specifically like those, so that we can serve the necessary abatement notices on the property owner to make those corrections.
Thank you for that.
And just for clarity to the listening public, Mr. Bryan, if you would allow, because some of the public may think and say, I've never seen a garbage closure on the road. This is what just beyond the road shoulder that is still in the legal thoroughfare of the road, of what is considered a roadway, just for clarity.
Thank you, Mr. Chairman. That does clear that up, and I'd only encourage the listening audience to be mindful of that, because we're starting to see a habit of people putting fixed containers outside on the roadside, not into their own property. Thank you so much, Ms. Sims. That answers my questions. I have a question for the minister again, though.
Just before, Mr. Director, can you also speak to whether or not garbage can simply be placed in a bin or it should be bagged?
Through you, Mr. Chairman, according to the regulations, the law, it only requires you to place a bag out, not necessarily a bin. But that's what the regulations require, just a bag at the minimum.
And give way to
Member for Borden Down West.
Mr. Sims, I just want to publicly thank you for always being professional, always being very responsive. I had an issue earlier. You take calls, you get action done, and on behalf of the people that I represent, I just want to say thanks, and to the team for the very good job that they're doing. I really appreciate it.
Through you, Mr. Chair, thank you, Mr. Saunders, for your kind compliments, and I owe it all to my team of professionals that we have at the Department of Environmental Health. So I'll certainly pass on your kind compliments to them. Thank you.
Yes, true leader, and I want to echo that, Mr. Chairman. And hopefully we can get that cost of living adjustment for those hardworking staff that you have down there to keep us clean. My question
no honorarium?
The honorarium too. We want to make sure that they get that as well. Mr. Chairman, can the Honourable Minister say, I filed a question a couple months ago. Silly me, I filed it a little bit technically different. I said, can the Minister say if the government's policy is to make any amendments to the National Conservation Council Committee? Council. What I meant was, is there any government policy on changing the National Conservation Act? Can the Minister answer that?
Mr. Chair, through you, I'll answer the member very similarly to how I answered you before, which is that we haven't gotten to the stage of any discussions in caucus about amending the National Conservation Act. So again, going back to this imaginary division that you think we haven't even started to talk about it as yet. So sorry to disappoint you.
I'm not going to take that. I'm not going to catch that ball you threw at me. I love you too much. I'm going to stop there. I'm not going to say nothing.
Members, HES 1, 2, 7, 8, 9, and 10. We seem to have exhausted. I know the honorable leader has some of the opposition has some questions on the mosquito.
Actually, there is one about the second one. Is the government committed to the Paris Agreement rules, and can you give us forgive me, yes, the climate change, Paris Climate Change Agreement. That's why you said Paris Agreement before. She didn't understand what I meant. The climate change agreement that was signed in Paris.
Honorable Minister.
Mr. Chair, just the line of the member's question confirms that there's still a lot of understanding that needs to take place with the public as it relates to the, did you say Paris Agreement?
Yes, ma'am.
So what the cabinet did was approve the extension for the agreement to be extended to the Cayman Islands. We would be the second OT that would have that extended to us. What hasn't really been mentioned is the amount of Caribbean islands that have signed up to the Paris Agreement. We have Jamaica, I mean, I could list them, Antigua, I had written it down, but I just can't seem to find my notes on Barbados, St. Kitts and Nevis, St. Vincent. I mean, I was truly surprised when I went to the last regional conference and realized that we were probably one of the only countries, Caribbean countries in the region that hadn't signed the Paris Agreement. And what I want to point out is that in 2007, the United Nations Framework Convention on Climate Change and its, I think you pronounce it, the Kyoto Protocol, Cayman signed up to that, which already committed us to decreasing emissions. So we aren't committing to anything that we haven't already committed to. So if there is a particular concern that you have, maybe you could elaborate a little bit more on what you feel we are committing to that we haven't yet done.
Well, I can promise you, and I'm imagining this one, right? You said we're not signing up to anything that we already not signed up to. So if you already signed up to it, you wouldn't have signed up to this one. With that being said, I'm coming from a genuine place. We all want to protect the environment. We all want to protect Cayman Islands. And I just don't want this to be an anti-environment or a pro-environment position. The simple fact is there is people in this country that have concerns about some of the things that we sign up to that puts a lot of regulatory hurdles in the way for, I would hate to use the word growth because it has such a negative connotation these days, but there is limitations in it. And I can tell you this, I'm certain that your members probably have got messages too when they heard about it, about what the implications of signing up to it means for the future for Cayman, not only in the positive, because obviously we all know about the positives because it's intended to have a environmental positive effect and sustainable effect. But say again? But there are sometimes perceived limitations or hurdles that can be derived from these agreements. Have you, I guess the question is, have you done an assessment or any feedback from the public on it?
Honorable Minister.
Mr. Chair, through you, again, going back to what I said earlier, this isn't really, we aren't doing anything or committing to doing anything that we haven't previously committed to in our climate change policy. And as it relates to the greenhouse, the annual greenhouse gas reporting that it says here, I made sure to get some facts so that I could clarify this. So the reporting of our annual greenhouse gases to the UK government is an existing commitment under that previous arrangement that I just mentioned. The DOE collates all necessary information for the annual inventory and already submits this to the UK. This inventory helps us understand our emissions across the economy and to craft, which we've done, our national energy policy and climate change policy. The Paris Agreement commits the Cayman Islands to increasing our ability to adapt to undeniable adverse impacts of climate change and foster a climate resilient and low emission development pathway that does not threaten food production. We have a steady and impressive track record of disaster risk management, but now this action is further bolstered by a long-term roadmap to resiliency under the climate change policy, which again, we've already signed up to.
Thank you so much. I'm just giving you an opportunity to try to give the position. I've said it. It's in the public record. There's some people who have concerns and limitations. If the government doesn't want to hear those, then that's fine. I want to move on to the last one in this area.
Member for Georgetown Central continuing.
Thank you, Mr. Chairman. The bull rush at the end of the airport runway, have we had a resolution to that in respect to the safety components for the airport and planes arriving and landing with the birds?
Honourable Minister.
Mr. Chair, I'll have to refer to the director on that. I'm not quite familiar. Give me 1 minute, please.
Oh, okay.
Mr. Chair, through you, I've been advised by the director that DOE has been working closely with CIAA to develop a wildlife management committee, and they've already been having discussions with an expert who deals with wildlife management around airports and situations as such.
Thank you very much. Again,
Member for Georgetown Central continuing.
Thank you, Mr. Chairman. As I said, I put it on the record. I continue to ask if anything goes wrong. I did my part. Sorry, there is the mental health thing that I want to ask. I'm so happy, Minister, that you are heavily focusing on the mental health of things. My only thing is, it's like the mental health support continue to flush in, and rightfully so. I don't know if you can, like, what is causing, this is a global thing, so it's not Cayman only, right? But what is causing this abundance of mental health issues across the globe? Have we identified things? Because I think we're putting things in place for people who are having the issues to talk about it, to support them, housing, all the different things. But are we addressing the root causes of it? Like, say, for example, I'm not a doctor, so I don't know. And Dr. Lockhart is here, I think, or some other doctors that are here that know about this stuff. But I'm trying to think, we need to start addressing the root causes of things. So, for example, my kids don't play video games because in my mind, I like too much video games. I run them in the bush, go pick some guineps. Kind of had a mental health issues. At least I don't think so. So I'm wondering if there is things that outside of the support that if you do have mental health problems that are related to other issues, have we identified them and are doing things to support stopping them from having mental health issues is what I'm saying. Does that make sense? Like social media even, yeah.
Mr. Chair, through you, I'd like to just liaise with the clinical director for our mental health facilities and also the CMO. And then I'm just going to ask you, Mr. Chair, I'd like to answer the member's question, but as it relates, because I've already asked Mr. Tatum if we could discuss his questions around mental health facilities when we get down, but I want to answer you now, and then if we could move on to the mental health line item.
Minister, if you feel more comfortable, since this is a very technical area, you might want one of your technical staff to answer the question.
Thank you, Mr. Chair. I'll ask Dr. Lockhart if he could respond to these questions.
Welcome to the committee, Dr. Lockhart. Just state your name and position for the record, and then answer any questions that members may have.
Thank you, Mr. Chair. I'm Dr. Mark Lockhart, psychiatrist. I'm currently the clinical director at Ponciana Rehabilitation Center in East End, and also the chair of the Ponciana Mental Health Advisory Council.
Thank you so much, Dr. Lockhart. So I think you may have overheard my question, and the intent is that the government is doing a great job focusing on mental health, having the support systems there for whenever it's identified. I guess the question is, for one, what are they? And then I guess I can ask the government, are they intending to find out what are the root causes that's causing much of the mental health today?
Through you, Mr. Chair. Excellent question, sir. And that brings up some valuable information that we've been seeing quite a bit in the media. So first I'll start with the recognition and identification of mental health concerns. And we compare that with where things were 20, 30, 40 years ago. A big example is the recognition today of the significance of the early onset of mental health challenges. So if we go back to when many of us were children, you would hear things about rude children, bad children, children that couldn't learn or they weren't smart enough and so on. And many of those issues stemmed from unrecognized, unappreciated, ununderstood mental health challenges. So we have come a long way in the world, in a sense, in terms of understanding mental health conditions. The seminal reference guide that we use to diagnose mental health conditions is generally accepted as the Diagnostic and Statistical Manual of Mental Health Conditions, which is called the DSM. We're now at the DSM-5. That we have over 300 different diagnoses in that manual today. And a lot of this has come over a lot of research and development over the past decades in terms of recognizing the subtleties and the origin of mental health conditions. Most experts in the mental health field recognize that mental health conditions or psychiatric conditions are really more conditions of childhood, in a sense. We're dealing with the manifestation of them in adults, but we know that up to 50% of mental health conditions have their initial origin before the age of 12. Up to 75% of mental health conditions have an origin or a manifestation before the age of 24. So I respect greatly this Honorable House and the ministry and what is being done in terms of recognizing, and I've been hearing that from all of your honorable members, that we as a country need to focus on identification early. Our children are mostly in schools. That's where they are. That's where we can locate them. Unlike adults where we might have some are unemployed, some are at home working in different places, we know that the majority of our children during the school terms are found in these institutions. And many of us in the mental health field feel that that's where we should direct some of our resources, health resources, identification, and other focuses in terms of eradicating or identifying these conditions to ameliorate or reduce the manifestation later on. Many of you have identified today, for example, that what we're doing here is being broadcast on YouTube. And it'll probably be on YouTube for, I don't know how long, years or whatever, highlighting the significance of technology. Technology has a double-edged sword when it comes to mental health. None of us are advocating that it should be eliminated, but it is very dangerous. And I think we're even hearing that day to day with what we're seeing with AI and the benefits, but also the serious dangers that poses for mental health conditions and for dissemination of information and ideas, both positive and negative. So that's another thing that we've been seeing. Let's even roll back a little bit from a mental health standpoint. Before we even had the cell phones and the internet, many of us grew up with our parents saying, be careful of TV, you're watching too much TV, you're taking in too much information from that static medium that can have negative consequences also on the development of coping mechanisms and other residual effects that can affect mental health. There are also theories regarding environmental toxins and other contributants that may be affecting our children's mental health and our mental health in general in terms of the types of food we eat, the processing behind it, the hormones that are put in certain types of meats that we get overseas and so on. I could go on, but I don't want to.
Well, Doc, I was thankful for you to give us a synopsis. Here's what I guess what we should recognize is we have to further go into the identification process. But the next step is after identifying it, what are we doing? And that goes into the other ministries, which the minister can speak to. But Minister, just before you say that, I just want to know that we're on the way of the steps necessary to eradicate, which is first acknowledge, identify, and then try to mitigate throughout those early years. And I'm hoping that that's what you're going to say next.
Honorable Minister.
Mr. Chair, thank you. Through you, I'd like to thank Dr. Lockhart for giving that detailed breakdown. What I'd like to do is ask through you if our director, Ms. Judith Seymour, who heads up the counseling service, could just speak a little bit about what you were asking as it relates to what we are doing, because oftentimes I think people don't realize how much is already being done.
Mrs. Seymour.
Judith Seymour, Director of the Department of Counseling Services. Thank you for the question. I just want to echo some of what Dr. Lockhart spoke about in terms of the impact of children's experiences on their adulthood. There's been some seminal research that was done called the ACEs, and it's Adverse Childhood Experiences. And what that research has demonstrated is that for persons who develop mental health problems, you can track back to see how many adverse childhood experiences they score, and it gives you an indication of their mental health. And so that is looking at what are some of the causal factors. I think you should also be aware that from the National Drug Council's perspective, their student drug use survey in the beginning really used to look at what the prevalence rates were. They're doing a much more detailed analysis now to look at why are young people using drugs? What are the antecedents to that? What are their life circumstances that lead them to make those choices? And that kind of information is allowing us to be able to develop programs. You mentioned, for example, social media and the impacts of the digital world. At the Family Resource Center, we offer workshops for parents to be able to navigate those challenges with their children, in addition to obviously then also offering therapy for families at the counseling center. So we have tried to create workshops, programs. We also have specialist parenting programs, for example, for parents themselves whose mental health may not be as stable as it needs to be, so that we can teach them with the limitations that they have how to effectively parent their children and break those cycles. So we are taking a very preventative approach by looking at what are the antecedents to some of the behaviors that we're treating.
Ms. Seymour, thank you so much. And I think it's so sad that we haven't done this. I don't think I heard it, but happy International Men's Day, everybody. And I had to take a woman to remind us of that. This is all too familiar for me in respect to the struggles or the experiences from a childhood perspective. And I think there's a lot that what you do should be trickled into everything else that we're doing, because I would hate to assume that with the increase of the mental health issues that we're seeing amongst our children, is that a reflection of the failures that we're doing with our children? I don't know if that's a fair question or not.
It is a bit loaded, but I don't think that the increase that we're seeing, I think you acknowledged from the start of your question that this is a worldwide phenomenon. And I think we recognize, for example, after COVID and the pandemic were a significant impact on people's mental health. We had children who were isolated, children who were not at school, adults who were isolated. And I think we're also seeing worldwide the impact of that now. We've also had a lot of disasters across the world. Those things impact mental health as well. And so I don't think that we can say that it is a failure on our part. I think that the system is actually much more, like I said, paying attention to not just the behavior, but why is the behavior happening, so that we can start to treat it.
Fair enough, and I'm going to stop here because we could talk about this all night. Very complex problem. Would it be fair to say, though, that majority of mental health issues are due to the quality of life of any one individual? Is that fair?
The quality of their life at some stage, yes, Mr. Chairman.
Okay. All right. Thank you so much, Mr. Chairman, and thank you, Minister, for allowing that. I hope that that kind of knowledge is trickled down into what we're doing as government and opposition, as members, to improve, because the stress, I'm starting to see so many people stressed out till they get to a point of mental health issues. A person that may never have ever thought would have a breakdown, or maybe not have any history of childhood experiences that are negative. But like you say, it's a global thing. The pressures of working too many hours and cost of living, pressures of expectations, the social media, all of it together. And we need to talk about this in a holistic perspective on the quality of life of our people, because otherwise this mental health phenomenon is only going to get worse and worse and worse and worse. So I'll stop there. Thank you.
Member for Bordentown West.
Thank you, Mr. Chairman. And through you, I could not resist asking Dr. Lockhart this question since he's here. It's been something that's kind of been on my mind. It's the impact of loneliness in many societies. They often say that the 4 worst things that can happen to anyone is being sick, old, poor, and alone. And we saw quite a thing back in 2017 or 2018, thereabouts, where the UK even created a Ministry of Loneliness. And we have now seen social media itself, where everyone having this, we call fear of missing out, where everyone is just scrolling or looking. And I came across something a while back, and what they said is that most people are scrolling, they're really trying to end their loneliness or that kind of stuff. And I'm just curious, and I'm asking in the context that, is this something now that we as legislators need to start focusing? I mean, recognize that there may be other symptoms and other causes, but loneliness is one in terms of trying to have more community activities or having more things to bring people together where people can be in a social environment and so forth. If not, this is something that we need to start focusing more. So I'd just like to have your thoughts on something like that, Dr. Lockhart. I really appreciate it.
Dr. Lockhart.
Through you, Mr. Chair. Thank you for that question, sir. I know that our CMO could probably elaborate a little bit more on this, but I know that in the last few years, the former Surgeon General of the United States actually spoke about loneliness being a public health issue. We are social creatures as human beings. If you look at a world map of population density and different centers, you'll see that most humans on the planet congregate in certain areas. You have large spaces in the world where there are no humans in a sense. So while as a personality feature, many of us may be on a spectrum of being more introverted or like are quiet or don't necessarily interact a lot, we still need human contact. It's extremely important. It's a fundamental part of our functioning. And not just for humans, but for many animals. I remember hearing a researcher talk years ago and saying that if you separate puppies, not to go back on the topic of animals, but if you separate puppies from their mom and feed them, but do not interact with them in any way, their time of survival is diminished, and there's a high risk or a higher incidence of them dying because of the lack of socialization and contact. I want to just piggyback on what my dear colleague, Ms. Seymour, said about the adverse childhood events. And I think it's very important for all of you honorable members to hear this, because this plays a major part in all of what you're doing. There's a belief many times that when we talk about adverse childhood events, we're talking about the most severe component, which would be physical or sexual abuse perpetrated against the child. Research has shown that having a parent that has a substance abuse problem is an adverse childhood event. Coming from a home with a single parent, where there's only one parent, is a form of an adverse childhood event. Having an incarcerated parent is an adverse childhood event. Being in an environment where you may have both parents, but there's a lot of arguing, tension, discontent, is an adverse childhood event. Are we saying that every single childhood event necessarily leads down the line to a serious mental health issue? Not necessarily, because there are other factors, personality factors, resilience, and we also have on the other side of this coin, in a sense, positive childhood events, or PACEs. So you have ACEs, adverse childhood events, and you also have positive childhood events. Where I'm going with this is twofold. Number one, we can focus our energy a bit more on identifying these situations that create or exist with adverse childhood events, to direct resources and identification. A quick example. We would know, for example, in any elementary school in our islands, which children may have a parent that is incarcerated, which children are not getting a meal, a hot meal to get to school, which children are living, in a sense, in daycare and so on, and start to identify those kids from an early age in terms of resources that they may need and support to provide to them. On the other side, we know that positive childhood experiences can help to counteract some of those ACEs and negative childhood events. Having an adult that is able to supervise, monitor, or interact. There is an interesting study by a colleague of mine at Stanford University that was looking into the impact of just a positive statement. And many of us can think back and give an example of a time maybe we were in a younger age where an adult who we looked up to said, "You can do it. You have the potential. I believe in you. I know you can do much better than what you're doing, and I want you to do well." And many of us can remember that. I'm sure everyone in this room almost can point out some adult, a football coach, an uncle, a grandparent, somebody that believed in you and motivated you. That's where things like Big Brothers, Big Sisters, other types of events, other types of NGOs and associations and contact are extremely important. Recently, I heard some talks about the quality of daycare. I think there was just a conference in terms of what our children are being exposed to for a large segment of our population today that are picking up their children from daycares. What is being said to those children? What are they hearing? How are the adults interacting with them? Those are all positive interventions that can help to counteract some of these adverse childhood events. And that gives all of you, honorable members, the remit and the information to be able to support and supplement those types of programs and those types of interventions.
Mr. Chairman, I just want to thank Dr. Lockhart for that question, and I realize I need to come see you because I have so many questions in this regard, but not as a patient, now don't get me wrong. But I just want to thank you, and no, I want to publicly say something because someone very close to me a couple of years back literally went like literally zombie mode, like very close, just completely snapped. And it was a shock for my family. And I can tell you, Dr. Lockhart and many were very instrumental in bringing her back to reality. And I just want to publicly thank you for that. But it's something I've seen, something I thought I would have never seen. I'm talking very, very close to me. And I know you would recall, but that's fine. But I just want to say thank you very much for what you did.
Through you, Mr. Chair. You're very welcome, sir. And I appreciate those warm words.
Mr. Tatum, member for Red Bay.
Thank you, Mr. Chair. Before I get to mental health, I did have something on climate change, but I'll say very quickly first, sir, that it was very good to hear us moving from animal welfare to people welfare, so I really enjoyed that conversation. Climate change. Question on our climate change policy. If you humor me, sir, I'll just read from an article from March 2022 from the Compass entitled Cayman 2050, How Surging Seas Could Redraw the Map. And this says, seawater laps at the southern shore of West Bay Island. Waves wash over the sunken remnants of 7 Mile Beach. To the east, a vast wetland stretches from Savannah to Gun Bay. The isolated Collier's Isle sits at the center of a brackish lagoon. It is high tide 2050, and Grand Cayman has splintered into a chain of multiple tiny islands separated by shallow waterways carved by surging seas. And the article then says this visualization is based on mapping data from the US-based Climate Central, a group of scientists and journalists set up to do things, work like this. So my question, sir, is I have no issue with signing up to the Paris Accord. All that is good stuff. But has any work started on what we may need to do with regard to sea defenses? I don't know if this will happen in 2050. Do I personally think it's a possibility it will happen at some point? Yes, I do. So have we started looking at some of the things that will really matter to us? Not that other things don't, but things like sea defenses. How does anyone think we'll be able to prevent any of this, or how much will we be able to prevent? And if we are to prevent it, the thinking and the work needs to start now. So if I could have some thoughts on that, I'd be grateful.
Honorable Minister.
Mr. Chair, can I just have a minute, please? Mr. Chair, I think if it's okay through you, I'd like to have the director just give a little bit of information in relation to what's being done.
Okay.
Gina Ebanks-Petrie, Director for the Department of Environment. In terms of what's being done for climate change, I think that the climate change policy that was recently adopted by government outlines a number of areas of focus for work in terms of climate change adaptation. No concrete decisions have been made in terms of whether we need to implement sea defenses. The policy starts from the perspective of protecting those defenses that we already have, those natural defenses, and that's the approach that most countries are taking. So mangroves, coastal mangroves, looking at setbacks for construction that respect what's happening now as well as future climate. The ministry, I know, is also developing a climate resiliency scorecard through a project that's being funded by the EU. And part of that will be to help us to understand how projects and policies, et cetera, stack up against future climate risk, and whether we ought to be taking and building in adaptation measures to our national planning, to our national policies. So in terms of actual work, we are trying to implement those procedures and those approaches that are laid out in the National Climate Change Policy as a first step. And then looking forward, we will be working, the government will be working across the department, the ministry, et cetera, to look at what future measures we might need to implement.
Thank you very much. Members.
Thank you, sir. There's a comment, I'll move on to mental health.
We have a range of outputs, and mental health can be taken at HEA 12, Mental Health Services. So let us get some outputs.
I will just close then on that topic then, sir, if I could. I appreciate what was said. All of the things that you mentioned need to be done here. But I think I believe we all know that nothing that we do here is going to stop sea level rise. So all of the things that we're doing needs doing, but it won't stop it. So we do need to start looking at adaptation and mitigation. If we don't start now, we won't get to a point where we have some idea of what we should be doing. I'll leave it at that. Thank you very much.
Thank you very much, Mr. Tatum, for that very, very important intervention. So, members, in accordance with Standing Order 83.3, I put the question as to whether honourable members approve the following items on the schedule described as HES 1 Policy Advice and Ministerial Services to the Minister for Health, Environment and Sustainability in the amounts of $9,880,268 in 2026 and $11,321,824 in 2027. HES 2.
Mr. Chairman, I have a question on HES 2, sorry.
It's to do with health regulatory services. All those in favor, please say aye.
Aye.
Those against, no. The item stands to the schedule, to the bill. Member for Bordentown West.
Thank you, Mr. Chairman, and apologies for slowing it down, but this is something that showed up on my radar quite recently. It regards companies on island purchasing health insurance coverage for their employees by using overseas companies. And I would like to know from what standpoint some of those overseas companies that are basically selling insurance to these companies in the Cayman Islands are licensed to do so. And the reason why I ask is that these companies require, well, the one that showed up on my radar, required employees to basically pay 100% and then seek reimbursement. And in some cases, the employee can't find the money. And something recently happened to one company that I know where something really bad happened to that employee. And I won't say it publicly, but I will speak to the minister about it offline. And I will detail the name of the company and what exactly had happened. But I would just like to understand what is the process that allows these companies to basically sell this, and also for companies to put this kind of financial stress on their employees. For full disclosure, I had reached out to Mervyn Connolly, who was was in charge of the Health Insurance Commission already on this issue, but now, because of what has happened since I reached out to him, I am now raising it at this forum because it's bad.
Honourable Minister.
Thank you, Mr. Chair. Can I have a few moments to liaise with the team? Mr. Chair, through you, I'm hoping that my short, concise answer will assist. If not, then I'll come back with supplemental answers. The overseas providers are only, we only have jurisdiction over the SHIC policy. As it relates to any other services, there isn't really a regulatory guide in that regards. Is that answering your question?
Technically, no, but I'm going to tell you exactly to move on from this because I put it in a public domain. But I think from a labor perspective, I'll speak to the Minister for Employment in that regard, and also yourself offline. But I can tell you up front, having employees try to find thousands of dollars sometime to pay up front, and then sometimes wait 4 to 6 weeks to be reimbursed, completely goes against what we intended when we want people to have health insurance. And some employees are afraid to speak of a victimization, and that's the reason why I didn't mention the incident here. But I can tell you, I look back at the census and I realized that we had close to 1,000 people back then, I think, in the census that literally listed overseas providers as their primary healthcare provider. And that kind of slipped my radar at the time, but until this incident popped up, then it really became a serious issue for me. And Premier, you had mentioned that you said there were some situations that you were aware of also.
Mr. Chair, if I could come in.
Honourable Premier.
It's funny because the member for Bodden Town West and I hadn't discussed this the entire entire meeting. But just at the beginning of this week, I had almost the exact same situation where someone stopped me to say that the policy had changed at their workplace, moved to an overseas company, and now the employee has to pay first and then be reimbursed. The amount of stress that already puts on an employee in a high cost of living environment, I told them I'd undertake to talk to, because more than one ministry, to be able to resolve this, to look into this, because that does not sound right at all. So you have our undertaking and we'll look into this.
And I think that is the right approach, because I think for this one, at least for the people who are affected, at least they can take comfort to know that one is on the radar and two will be dealing with it.
Members, I announced during my contribution to the budget debate that I am setting up a bi-party committee that is going to review national health insurance, and it's for this. This is yet another example of why the government is taking this approach. We will not come to the end of this term kicking this can down the road. It was being kicked before I entered this house in 2000. It's still being kicked. We have to do what we have to do. We have a unique environment. We have a unique economy. The government simply has to do what it has to do and get the work done. HES2, Health Regulatory Services, in the amounts of $3,287,301 in 2026 and $3,428,550 in 2027. HES7, Collection, Recycling, and Disposal of Waste, $10,904,842 in 2026, $11,802,008 in 2027. HES8, Public Health Services, $3,346,702 in 2026, $3,389,321 in 2027. HES9, Environmental Health Monitoring Services, $1,560,684 in 2026, $1,564,569 in 2027. HES10, Emergency Response Services, $165,790 in 2026, $166,172 in 2027. All those in favor of those items on the schedule being part of the schedule to the bill, please say aye.
Aye.
The ayes have it. The Honorable Leader of the Opposition, you had a question on HES 11.
Yes, Mr. Chairman, thank you. Through you to the Honorable Minister. First, let me acknowledge in your comments that the government will be purchasing another aircraft. That's fantastic news.
Just to put it on mic, yes, sir, that's correct.
And I had a chance to see a social media video, Minister, with a drone doing a larvicidal sites, over larvicidal sites. I think it was actually in the Dyke Road behind my house, which is good news. Keep testing it there. Those are all good news. And then I saw your description here. You had a reduction in the budget for MRCU. And I saw the explanation that they have, previous budgets, they have fallen below the $10 million. I just want to make sure and hear from you, Minister, that you're very comfortable about this, that there are reasons you can be below budget. And I ask these questions because this was a very difficult year for mosquitoes. And, you know, there's a section of my constituency I rarely hear from, but I heard loud and clear from them along the peninsula, as we call it, this year because of mosquitoes. And I just want to make sure that the reasons that we're not below budget is because we ran out of materials or products or just want that reassurance, Minister. And I noted that I think the mosquito season started a bit earlier this year than usual. So,
just give me one moment, please. Mr. Chair, through you, I guess predicting the mosquitoes is like predicting the weather. We will hope and pray that we don't have a bad year, as they refer to it, at MRCU. One of the reasons why there was a higher number before was because of the purchasing of the larvicide, and because we only had one aircraft, some of that equipment, some of that, it might be best, Mr. Chair, if I just get Dr. Wheeler to just explain this in detail as it relates to the larvicide, or in the interest of time, I'll be guided by you. Simply put, we feel comfortable that the 10 million should cover the year, and we'll see. If the member seeks further elucidation, I'll ask Dr. Wheeler to elaborate.
Thank you, Minister. I don't want to drag him on, and like unlike the no-see-ums and mosquitoes, we can see, feel. Through you, Mr. Chairman, to the Minister, I would like to take this opportunity to publicly thank Dr. Wheeler for his accessibility and always getting back to me. It makes it a lot easier dealing with my constituents when I can give them a detailed response. And he's always upfront and forthright. And we never hear if he says a plane is down, I tell my constituents a plane are down, they're satisfied. And so I just want to go on record for thanking him for always responding and being upfront with us. Thank you.
Mr. McTaggart, member for Georgetown East.
Thank you, Mr. Chairman. Through you to the Minister. Minister, we keep talking about one plane, but as far as I know, we have two. Am I correct?
Mr. Chair, through you, yes, you're correct. And the second aircraft is down because it had the engine had issues that needed to be repaired. So we're down one aircraft, and now we're seeking to purchase a new one. But I think it's safe to say that, and I think I spoke about it a little bit in my statement, that they're aging out.
Okay, I fully support the move to get a new plane. Those planes that we have there are quite old. They are worn out, and the reliability just simply is no longer there for the aircraft. We don't need one, we need two. And so I would encourage you, let's see if we can find the money, because otherwise we end up with the same situation that we've had here now, where the one plane breaks down and those two old things just not working or not airworthy. I just believe it would make eminent sense to allow MRCU to acquire two planes that would give them the reliability and redundancy that they desperately need.
Thank you very much, members. So I would propose to take the vote on the rest of the items down to medical care for indigent, and see if there's any questions on.
Can I just ask one more question, Mr.
Certainly, Mr. McTaggart.
Minister, you to the Minister. We have one pilot, am I correct? Two pilots.
Honourable Minister.
We still have the Caymanian pilot, though. Okay, that's all I needed to know. Thank you.
Okay. Thank you, honourable members.
Mr. Chairman, any particular reason why we don't have two Cayman pilots? I mean, the amount of money I spent in the last administration on Caymanian pilot scholarships, I'm certain we can. Matter of fact, here's a question. Any succession planning for the other pilot?
Very good. Honourable Minister.
Mr. Chair, through you, we have one full-time pilot, which is a Caymanian, and then we have a contract pilot. And what we're hoping to do is to recruit for a new pilot as we look at acquiring a new aircraft.
One second. When does that contract end?
Honourable Minister.
You're referring to the part-time contract?
Correct.
Mr. Chair, it expires December of this year, but there is an intention to renew it at this stage.
Thank you. Through you, Mr. Chairman, Minister Michael Miles is a strong advocate for transitioning. and I know he's working on this collaboration of Kids Away to School. I would encourage yourself and Mr. Minister Miles. We gave out a number of scholarships over the last 5 years on pilot scholarship program that I started, and I'm certain that you can find a young Caymanian who's coming home. And I know it's kind of short notice for the end of this year because December is around the corner, but by the end of 2026, we should be able to put a Caymanian pilot in that seat.
Honorable Minister.
I thank the member for his observation. We are working collectively as a team to look at succession planning and utilizing the workforce database that Minister Miles is working with his team to provide to each of us.
So members, in accordance with Standing Order 8033, I put the question as to whether the honourable members approve the following items on the schedule described as HES 11 mosquito control services in the amount of $10,155,000 in 2026 and $10,354,000 in 2027. HES 18 counseling and support services in the amounts of $6,225,770 in 2026, $6,245,957 in 2027, HES 19, Public Education and Social Issues, $230,678 in 2026, $226,437 in 2027. HES 21, Environmental Services and Research, $8,099,726 in 2026, $8,513,223 in 2027. HES 22, Residential Mental Health Services in the amounts of $11,478,152 in 2026 and $12,740,613 in 2027.
Mr. Chair, I just want to have a question.
There are four other items with mental health services, including HEA2 mental health services, as wide open as you can get. All those in favor, please say aye.
Aye.
Those against? The ayes have it. The items stand part of the schedule to the bill. HEA2, medical care for indigents.
Mr. Chair, could I ask that you, at the next opportunity, that you recall that I have a question on mental
Oh, yes, and I
mental
said
health?
that too. I was going to wait for HEA 12 is what I'd indicated.
12, okay.
Mental
All right,
health
I saw it on the 22, that's okay, fine.
Yes. HEA 2, in accordance with Standing Order 83.
Chairman.
3.
There is an ongoing issue that causes much delay for persons who are getting services from the DFA, which has to do with waiting on doctors at HSA to signify a person's ability to get insurance or get care based on their the doctor's medical opinion, which holds up the process. And I know that when I was minister for DFA, I was trying my hardest to streamline that process a little bit better, because it takes easily over a month for DFA clients to get processed. Is there anything that we've done now to get that more streamlined? And the former chief officer would probably be fully aware of what I'm speaking of. Maybe beneficial now that she's the chief officer for this, to see if there's any progress in that area.
Honorable Minister.
Mr. Chair, just ask for a moment to converse with the team.
Yes.
Mr. Chair, if I could give a brief intervention.
Honorable Premier.
Because the member for Georgetown Central and I would have shared the same pain on this, so he knows I know the background of the issue. And I want everything in our power, that not this term, but in the next 6 months to finish this. This is as a result of a historical hangover in the Health Insurance Act of the definition of indigent and who signs off on it. Once you get it signed off, not on the advice, the Minister for Social Development, on the advice of the head social worker. So right now, in our world, that's Belinda, Director of DCFS. So you enter through DFA with the application, it goes to HSA, then it goes back to DCFS, then finally gets to Cineco. So we have talked about this in the prior caucus that we could all at least agree DCFS should not be part of the process. That was back in the day when there was a medical social worker at the hospital. And that's when the definition was crafted. We need to amend the definition, and you have other amendments that are coming, but this is one of those areas where if that's taken too long, you just need to bring this amendment and then work on the rest. To amend that definition to house it. The difficulty sometimes is wanting to know whether the workload will then shift onto another agency. But the DFA has a very, and they probably briefed you as well, has a very good solution of data sharing so that you don't have to have all the staff housed and the work can be shared up equally. The point that we're trying to get to is that the client or the applicant has one single point of entry. Data is shared to expedite the decision. It starts with that statutory amendment.
Thank you, Premier, for that intervention. Just for further investigative question here. There's always this discrepancy of opinion, not on the indigent, but whether somebody can work or not. I've had clients who, their back is hurt and they can't physically do anything else. I've had feel that they can't work anymore. I've had, matter of fact, you guys may be quite familiar with this case. I think the Deputy Premier does. A Caymanian who now walks around with a heart monitor, who came from the industry of physical work, so not computer typed or whatever, and they said, I don't know how to do anything else. Now, granted, the doctors have done some amazing things and keep him alive walking around the monitor, but get a job anywhere else. But the doctor rightfully says, I technically can't say you're indigent because you could potentially be answering the phone. Now, the probabilities of a almost 60-year-old person with a heart monitor getting a job in Cayman is like almost nil. But we won't sign off and say that the person is indigent to get the help from DFA. So I'm having some issues where DFA wants to help, they are obligated based on their rules, but the doctor won't sign off on it, and we do need to almost centralize this point too, which is there going to be a certified authority within DFA as a doctor there, coinciding with other doctors and potentially could overrule a different opinion and have other social factors involved. But what we're having is people are afraid to make conscious decisions and it makes sense logically to give support to people because the only thing they're relying on solely is the doctor, and the doctor is not going to jeopardize their own license when what can a person do to work is a very subjective matter. You have somebody who could be bedridden and can technically do work in some capacity. So this description of what work is affecting the ability for DFA to give services and help. I don't know if there's any viewpoints on that. Are you thinking about it? And how do you plan to address it? Because it is an issue.
Honorable Premier.
Briefly, because this falls slightly outside of health in the sense that it would impact the social development minister. So the person would be assessed as financially indigent in the cases I think you and I have had in the past. So the money is out of it because it's clear they can't make an income. The question is whether or not they are permanently disabled. And so the question might come back and say, if you're able to move around or use your mind, are you disabled? Because there could be some sort of work you could do, answering phones or whatnot. So it gets into a gray area. So we do need, I take the point, we won't be able to answer it today, but we got to reshape the definition of what you mean by permanently disabled, because they might not be able to really do anything. So technically, maybe they could pick up phones, but are you going to find a job for that? So I take the point. The second thing is, in terms of the overall service level, in terms of centralizing it, because that was the word that you used, which I think is correct, it would then maximize the services and turnaround time if we get this housed in the right departments. So the amount of time that it takes the director of DCFS to sign off on these, which really she shouldn't be a part of the equation, pulls her away from her day job. So the stress on the staff of not having this aligned properly is also impacting the service delivery of their primary functions. We have to get it sorted.
Pursuant to Standing Order 83-3, I put the question to honorable members that we approve the items on the schedule described as HEA2 medical care for indigents in the amounts of $28,300,000 in 2026 and $25,300,000 in 2027. HEA6 medical services for Cayman Brac and Little Cayman in the amounts of $4,161,000 in 2026 and $4,161,000 in 2027.
Mr. Chair, I just had a question in HEA 6.
Can we then take the vote on HEA 2? All those in favor, please say aye.
Aye.
The ayes have it. HEA 6.
Thank you, Mr. Chair. In taking a close analytical look on page 286 of the budget, I see that the 4.16100 has remained constant in from 2025, 2026, and 2027. And so I just would ask if the Honourable Minister could confirm that after scrutinization, taking deep dive, it was found that things weren't too bad at the Faith Hospital, or is it the case they were bad and we didn't get the funding? And that's not directed to you personally. I'll follow up and put it in better perspective afterwards.
Honourable Minister.
Mr. Chair, through you, thank you to the member for the question. As we prepared the budget, I've been advised that this line item should take care of HEA 6 as it relates to medical services in Cayman Brac and Little Cayman. But as we see with health, a lot of times these cases could change. I mean, hopefully we are going to be rolling out, not hopefully, we are rolling out preventative care as it relates to the HEARTS program. And so we're going to be focusing on ensuring access to health care for persons before they get to a place of needing to rely on HEA 6.
Thank you, Mr. Chair.
Continuing.
And thanks to the Honourable Minister. Numbers don't normally lie, so I'm very, very happy today to see that the numbers have remained constant, because during the lead up to the campaign, if you weren't living in Cayman Brac and having access to wonderful services that we have at the Faith Hospital, you'd be looking for a microscope for the better days were coming, because this was one that was beat to death.
Honourable, well, I'm happy that my colleague, the leader member from Cayman Brac East, is happy. And so with that, in accordance with Standing Order 83-3, I put the question as to whether honourable members approve the following items on the schedule. HEA 6, medical services in Cayman Brac and Little Cayman in the amounts of $4,161,000 in 2026 and $4,161,000 in 2027. All those in favor, please say aye.
Aye.
Those against, no. The ayes have it. The item on the schedule, the item was approved to the schedule that forms part of the bill. Members, at this hour, I would propose we take a 30-minute break. Honorable members, we're reconvening this meeting of Finance Committee. Please be seated. On the appropriation schedule, we have reached HEA 10, ambulance services. Member from Bordentown West.
Thank you, Mr. Chairman. Mr. Chairman, through you to the Honorable Minister, I notice on the purchase agreement, HEA 10 deals with HSA 23 ambulance services. And I couldn't help but notice the note at the end of HSA 23 that says, note, output scope expanded to cover EMS stations serving the Eastern Districts, providing over 7K non-emergency patient transport. EMS rates have not increased since 2002/2003. So we're just trying to understand how does the operation of the HSA works in that regard, and if it's a situation where the EMS service is now being subsidized in something else.
Honorable Minister.
Mr. Chair, if I could just have a minute to discuss this with the CEO. Mr. Chair, through you, the process is the same. What has been established is that a lot of the calls were for non-emergent care, and so what has been done is that there is a different method of transport being utilized for patients that do not require emergent care.
Thank you.
Honorable member, continuing.
Thank you very much, Mr. Chairman. Mr. Chairman, through you to the Honorable Minister. So if a non-HSA facility wants to use the ambulance, what is the current process now in terms of, like, from the time they request it, or how does the process work?
Honorable Minister.
Mr. Chair, just 1 minute. Chair, could I just ask the member to repeat the question, please?
Okay, if a patient needs to go in between hospitals or it's originating from a non-HSA hospital, what is the process in terms of the ambulance being used?
Mr. Chair, through you to answer the member's question, typically those facilities have their own vehicles for transport. However, there was a period of time where one of the private facilities' vehicle was down, and so they then utilized the vehicles from the HSA. Purchased. So the services were purchased, weren't done for free.
Honorable member, continuing.
Thank you very much. And in purchasing that service, I mean, who sets the price, or how is the price determined to ensure that it's basically the market value?
Honorable Minister.
Mr. Chair, through you, the charge that was determined was just the labor of the staff by way of time and a half, plus the additional ambulance charge.
Thank you very much. And just through you, Mr. Chairman, to the Honourable Minister, that approval process for when the ambulance is used for another non-HSA facility, what is the internal approval process? Who approves that the ambulance can be used for that?
Honorable Minister.
Mr. Chair, this approval was in consultation with the board.
So if, let's say, Health City or another hospital need to move a patient and their ambulance is down and they're using the HSA's ambulance, are you saying that to use the HSA ambulance, that has to be approved by the board?
Honorable Minister.
Mr. Chair, I can say that that is the present arrangement. However, I will tell the member that this is an area that we are looking at changing as we move into a more national public health regime.
Okay, well, yes, sorry. Through you, Mr. Chairman, to the Honourable Minister. So if there's a person that needs to be moved at 10, 11 o'clock at night, I mean, are you saying that they have to get the board approval or a member of the board approval to move somebody at 10, 11 o'clock at night?
Honorable Minister.
Mr. Chair, I need to confirm this. Mr. Chair, through you, Mr. Chair, I still need to get further clarification on this. Give me 1 second, please. Mr. Chair, through you, the current arrangement is that whenever the private facilities are down an emergency or ambulance, they typically would express their need through the CEO, and then she would seek approval from the board. This is typically done throughout the day. It's not on a case-by-case basis. However, in the absence of having that arrangement in place, the patient would typically be transported to the HSA.
Yeah, Mr. Chairman, your eyes can roll in just like mine too. Mr. Chairman, through you, under what section of any law, whether it be the HSA law or the public authorities law, does the board approval get, or the board process gets involved into the day-to-day operation of something as simple as a patient using an ambulance? Bearing in mind that 9.5 out of 10 times, that's a Caymanian patient, whether they move from El City. Where does the board get into this?
Honorable Minister.
Mr. Chair, I'm happy to ask further clarification from the CEO, but as I just said to the member, this is an area that we are looking to rectify.
Through you, Mr. Chairman, when did this process change and where the board got involved?
Mr. Chair, through you, let me just speak to the CEO, please. Mr. Chair, through you, I've been advised from the CEO that this is the second episode since 2025 that the approval needs to go through the board. Prior to that, if a facility reached out and asked for support because their vehicles were down, it did not require board approval.
From Bordentown West continuing.
Through you, Mr. Chairman, just out of curiosity, when this meeting happens with the CEO to give the approval, is this one of the meetings that is also charged $750?
Mr. Chair, before we get into that line of questioning, let me just clarify what I said earlier with saying that this is the only, so it's not like it was done before, that this request is a new request. So the CEO just clarified that to me.
Okay, thank you. But when they meet with the CEO to discuss this new request, is this HSA being charged $750 for that meeting?
Honorable Minister.
Mr. Chair, I've been reliably informed that they do not.
Thank God, because if it went with the ribbon cutting, I'd be pissed. Mr. Chairman, I will just leave this because, like I said, we have the PSC coming up and we'll dive deep on this at the Public Accounts Committee.
Members, I know that there's a request for Mr. Tatum to ask certain questions around mental health. Can members give any indication of other items? Because once he's done, I would like to take as
I have one on what we were just discussing.
ambulance services. Leader member for Camelback East.
Thank you, Mr.
Questions on HEA 10.
Thank you, Mr. Chair. To the Honourable Minister, just for clarity, when this such said request comes in, does it go to the CEO or does it go to the board? And if it goes to the CEO, what type of environment obtains at HSA? Because I consider this an operational matter that the CEO would feel coerced or that she has to report to the board. That's very unusual. for good governance.
Mr. Chair, can I just ask for a moment to converse with the CEO?
Mr. Chairman, we can move on by consent.
HEA 11, District Health Service at District Health Centers. No, I'm just going to get to 12 and then we're going to. Member from Bordentown West.
Mr. Chairman, I noticed that HEA 11 that deals with district health clinics deals with output. HSA 31, HSA 32, HSA 33, HSA 34, and HSA 35. And I couldn't help but notice that in those votes, I can't find the page, but I remember it's still good, that the West Bay, is there a clinic right now in West Bay? Because I know West Bay went from zero in the budget all the way to 500,000. So that kind of jumped out to me in terms of the forecast for this year.
Honorable Minister.
Mr. Chair, through you, of course, Mr. Saunders' keen eye would catch that. And the reason why is because the West Bay District Clinic has typically been self-sufficient, so there hasn't been anything budgeted for the district clinic. However, now we have rolled out the dialysis service, and there is an increase in patients. Plus that, we're looking at additional services. So that's the reason why there wasn't a line item before for West Bay, and so it was included in all of them.
Thank you very much. Now, this begs my next question now. I noticed for HSA 31 that deals with services at the Bordentown Clinic, Bordentown is getting $250,000. For HSA 32 that deals with East End Clinic, they're getting $100,000. And HSA 33, North Side, is getting $200,000. Georgetown at HSA 34 is getting $3,026,000. And then HSA 35, West Bay for $500,000. I am curious as to why Bordentown is at $250,000 and West Bay is at $500,000. I'm just curious to know what is the differences in services being offered between the district clinic for Bordentown and district clinic for West Bay.
Honorable Minister.
Mr. Chair, thank you. At present, it subsidizes the dialysis unit, which was just, sorry, 1 minute. for clarity, it subsidizes the operational cost.
Operational cost of the clinic? So just for clarity, West Bay is offering a different suite of services than Bordentown.
Yes, as of right now, we have the dialysis unit there. We do intend to expand the services. That's the next clinic that will be having the dialysis services eventually.
Okay, no, back up now, because this is exactly because the funding for both years now for Bordentown is $250,000, and for West Bay is $500,000. So I'll have to ask the question now for my dialysis patients, Caymanians in not just Bordentown, but even Eastern and North Side. Because I mean, we do recognize the issue of dialysis, and we see where diabetes itself and others have their own issues. But from that standpoint, when can we expect dialysis service to be in Bordentown?
So, I know. Mr. Chair, through you, one of the conversations that I've been having with the CEO and her team is each of the different district clinics, and we talked about the fact that Bordentown and West Bay have the highest volume, save for Georgetown. In terms of the dialysis unit in Bordentown right now, space is the issue, but it is the area that we would want to put dialysis as it relates to another district clinic. It's just not something that is forecasted at the moment.
Well, recognizing that Bordentown, Eastern and North Side represents the Eastern districts, which on a population basis is greater than the West Bay, is there any intention in the next 2 years under this budget to expand dialysis service to the Eastern districts? That will also serve Eastern and North Side for their cabinet members who are sitting in cabinet.
Well, it would serve the patients, and hopefully my cabinet ministers don't have to get dialysis.
After these questions from Kenneth, they will need it.
Mr. Chair, through you, Mr. Chair, through you, we didn't have any present plans, but given the concerns that the member has raised, we will certainly look into this.
Thank you very much, and I'm looking forward to coming back here. If you need a Section 11, well, you guys can do Section 11 or Section 12 to approve the funds to move dialysis to the Eastern districts. I welcome that at any finance committee anytime. Thank you.
Mr. Tatum, member for Red Bay, you had questions on mental health services.
On mental health facilities, thank you, Mr. Chair. Mr. Chair, to the Minister. Minister, you had indicated, I believe, that at the appropriate point, you would prefer to respond to my questions on the time frame for the completion of the youth mental health facility, the permanent one, as well as the location. And also you had indicated in your report, you said I can speak more expansively on the future plans of the facility that is the Ponciana Rehabilitation Center. when we get to the output appropriation, so I guess we're here. So I'll be grateful to hear from you on those. Thank you.
Honorable Member for Red Bay, your questions are confined to HEA 26, 29, and Poinciana, am I correct? Because there is a specific section, output group, for adolescent mental health, inpatient and adolescent mental health. HEA 26 and HEA 29. Because I would prefer them to take a block vote to that point.
That's fine.
Okay.
Yeah, you'd indicate you want to do it, but that's fine. Okay. So you tell me when you want me to address those.
So members, in accordance with Standing Order 83.3, I put the question as to whether honourable members approve the following items on the schedule described as HEA 10, ambulance services, $3,716,000 in 2026, $3,716,000 in 2027. HEA 11, services at district health clinics, $4,076,000 in 2026, $4,076,000 in 2027. HEA 12, mental health services, $5,835,000 in 2026, $5,835,000 in 2027. HEA 16, geriatric services, $4 million in 2026, $4,080,000 in 2027. HEA 17, medical care beyond insurance coverage / uninsured, $2 million in 2026, $2,040,000 in 2027. HEA 18, school health services, $2,500,000 in 2026, $2,500,000 in 2027. HEA 19, medical care for chronic ailments, $1,360,000 in 2026, $1,387,000 in 2027. HEA 20, public health programs, investigations, and treatments, $2,500,000 in 2026, $2,500,000 in 2027. HEA 21, medical internship program, $287,000 in 2026, $287,000 in 2027. HEA 23, provision of antiretroviral medication, $492,000 in 2026, $501,000 in 2027. HEA 24, provision of psychological trauma diagnosis and treatment for children, $208,000 in 2026, $208,000 in 2027. HEA 25, management and maintenance of cancer register, $136,000 in 2026, $136,000 in 2027. All those in favor of those items forming a part of the schedule to the bill, please say aye.
Aye.
Those against, no. Those items are approved as the schedule to the bill. HEA 26, adolescent mental health hub, Mr. Tatum, for MP for Red Bay.
Thank you. Do you want me to repeat the question? It's with regards to the time frame for the completion of the new facility and the location.
Thank you, Mr. Chair. Mr. Chair, through you, just to be clear, the member is asking about the interim adolescent facility or the long-term facility?
The long-term, you responded on the...
Right, I just want to make sure. So the long-term facility, we are hoping to start in 2027, and we're hoping that that should be completed by 2029, if all goes as planned.
Sorry, Mr. Chair, and the location?
The location, through you, Mr. Chair, is across from Pasadora Place, which is property that is already owned by HSC.
Thank you. Mr. Chair, where did you say was the spot I would ask the other question, sir? Because I was originally looking at doing this for the report. The other one has to do with the minister giving details on Ponciana. The
And
future of
is this
Ponciana.
about, is this just in regards to operationalizing Ponciana?
It was with regards to what was on the report, where she said I can speak more expansively on the future plans of the facility when we get to the output appropriation.
So Minister, if you could speak to that now, and then we'll take a block vote for the remainder. If members can indicate where they have questions next. NGS.
Mr. Chair, you want me to go ahead and answer before you put it to vote then? So just to answer the member's question, the bed capacity at the facility is 54. There's a number of 9 cottages, 6 residents per cottage. Presently, we have 3 occupied. Ponciana remains a bridge between hospital care and community life, which helps residents rebuild confidence, stability, and independence. And so the focus is more than just on rehabilitation, or it's more on rehabilitation than it is. Rehabilitation is more than recovery. It's about giving people the tools and support to thrive after treatment. So one of the areas that is going to be focused at the facility is a comprehensive dual diagnosis and long-term residential program, which will give people integrated care at home and keep families together while they're receiving treatment. This one, I think, is particularly important to many of us in the room. It relates to our senior care and dementia program. And so the intention is to create a dedicated dementia and neurocognitive program at the facility, which will give seniors and their families the dignified, reliable support that they need. And in doing so, building compassionate systems that care for the respect that we want to show to our elders. Many of us, I know I have been personally touched by this disease, and I think many of us have. And so allowing our seniors who have been diagnosed with dementia the ability to go to a facility where they are taught how to manage living with this new diagnosis. Oftentimes, there's a transition period when they get their diagnosis and they have medication just for them to adjust, so allowing them to have that space to do so with the care of physicians and the psychiatric care. In addition to that, one of the things that we're hoping to roll out in the early part of the new year is a senior daycare program where the bus, Ponciana already has a bus, so the bus will collect seniors, and again, going back to the functional program that the business case spoke of when it was originally finalized for this project, is ensuring that the facility is functional. So I think that this is a wonderful move forward. We've heard a lot recently about the dementia, the cases of dementia on the island, and the fact that we do have an aging population. So I'm really excited to see the way in which the director and the clinical director are moving the facility forward.
Mr. Tatum, continuing.
Thank you very much. So, so are we expanding the facility then, or is that using what's there now?
So we're just utilizing the facility, which has been underutilized because we didn't have adequate staffing. And the way that the cottages operate is you have to hire staff in clusters. In order to open a cottage, you have to have a certain amount of personnel. I had my notes earlier, but because I can elaborate more if you'd like me to, but what we are doing now is we are increasing the staff complement so that we can, that's all that's required. Required is to increase the staff complement so that we can continue to open up another cottage.
I thank the member for that. So that is good news. Dementia is a huge problem now. It's going to get much larger. So that's good to hear. Could you just repeat for me? I didn't write it down. The long-term youth mental health facility, did you say it'll be finished in 2027?
Oh, sir.
I didn't think so. Sorry.
I wish I could say that we would be finished in 2027. We're hoping to start it in 2027.
Start in 2027 and finish.
And we're hoping it will be completed by 2029.
2029. Thank you.
If there are no further questions, I would propose, well, let me just ask members, where on the appropriation, the schedule, does members have any further questions? Otherwise, I'll take a block vote. And with the cooperation of members, whom I thank, in accordance with Standing Order 83.3, I put the question as to whether members approve the remaining items on the schedule described as HEA 26, Adolescent Mental Health Hub, in the amounts of $1,200,000 in 2026 and $1,200,000 in 2027. HEA 27, Provision of Molecular Biology Testing Services, $2 million in 2026, $2 million in 2027. HEA 29, Inpatient Adolescent Mental Health, $1,454,456 in 2026, $1,498,090 in 2027. HEA 30, Mobile Crisis Intervention, $684,796 in 2026, $684,796 in 2027. NDC 1, Policy, Prevention and Education, Research and Information, Dissemination and Evaluation, $1,105,000 in 2026, $1,146,000 in 2027. NGS 4, HIV, AIDS, and First Aid Public Education Programs, $40,000 in 2026, $40,000 in 2027. NGS 53, Palliative Care Nursing, $300,000 in 2026, $300,000 in 2027. NGS 55, Tertiary Medical Care at various local and overseas institutions.
Mr. Chair, I have a question on that.
So I take all those in favor of the preceding items on the schedule forming part of the bill, please say aye.
Aye.
Those against, no. The ayes have it. NGS 55. Lady Member for Kimmenbrack East.
Thank you, Mr. Chairman. I note that for the appropriation for 2026, it's 43 million, and the same amount for 2027. And I also note from looking that 2025 was 55 million, which, if my calculations are right, is probably about 12 million difference. Take this tongue in cheek. Is that where we got our surplus of 11.1 million that is shown on page 34?
No. The answer, no, Lady Member.
Having said that, then perhaps this is an opportune time for the Honourable Minister, perhaps your good self, to explain what we're going to be doing differently to ensure that we've kept with what the Minister wanted, a transparent budget. And I can't blame her for that. The previous Minister wanted that too, but consecutive governments, including former Premier and myself and others, have put in an X factor and then come back for Section 11 5s or Section 12. So this takes it a bit further, but it's just one of the examples where it's under budgeted for the same reasons as other persons did it. It's probably more for you, Mr. Chair, than the Minister.
So, Member, thank you very much for the question. We budgeted at just over 80% for a number of reasons. One is the Minister is going to be rolling out a number of different services to try to get our community healthier. That won't happen overnight, but we also have committed to looking holistically at our national insurance framework. And we believe that if we do this correctly, and if we're committed to ensuring that national health care is going to be taken seriously, we are going to wind up in a situation where the government looks much more strategically and wholesale at how we go about procuring insurance and reassurance nationally in the truest sense. We all know that for the longest time we have allowed the private sector to mandatorily cover healthy people, including children. They reap the profit as soon as a child either reaches its lifetime maximum or acquires some chronic ailment. They wind up on the doorstep of government. When healthy adults reach that point or reach the age of retirement, the premiums spike so high that they wind up on the doorstep of government. We believe that in this review and putting together a true national plan where we take the standard health insurance contract and make that a level of service that the vast majority of Caymanians will look at and say, this is good health care, good health coverage. And combine that with what we know we're already paying out directly out of pocket versus insuring our country properly. We believe we can save costs by doing that. Because in doing what we're doing, we're simply on a pay-as-you-go plan where we simply keep funding, and there's no end in sight. And so I'm asking members, and that's why I've said publicly, I said it to the Premier and colleagues, and I've said publicly, this has to be a bipartisan committee. This is not government doing any form of research and then coming in the committee room and saying to the opposition members, here's what we found. This has to be a true bipartisan approach where the research is done and the government will then have to make a decision about what true national health care is going to look like and how we are going to cover the vast majority of our population. I can't say enough. I think all of us have seen the evidence for a few decades, and we know where some of the cracks are. But at the same time, I think we have enough brain power in the private sector, at Cineco, and certainly in this House, that we can perform a comprehensive, bipartisan review and ensure that we do what is best for the country. There are going to be people who are going to be upset. I do not go into this with any blinders on. But I think you know me well enough to know what is in the best interest of Cayman is my priority. What is in the best interest of the public purse should be all of our priority. And so we provide all those factors, and this is where we've landed. And so once we've come out of that review, we will then see where we land.
Thank you, Mr. Chairman, for that very well articulated pontification, which I fully concur and wish to publicly associate myself with. But my real question was whether or not that can be realized next year. And I understand where you're going with it. I'm just leveling the ground and preparing the playfield, because when the Honourable Minister comes back for the other 20%, I want to make sure it's not an adversarial environment for it, and that the public would not think that she has overspent, which is not the case.
I thank you very much for that very fair and very fair assessment. And so I believe in setting aggressive targets, because when you don't, we become wishy-washy and we kick the can down the road. I think with real will, we can get this review conducted expeditiously and move forward. Is there a risk that it might not all be realized in 2026? Absolutely. Absolutely. However, if we give ourselves an aggressive timeline, that will force us to do the work that we have to do. Any further questions? One thing we can say, the member for Georgetown Central is nice guy. In accordance with Standing Order 8333, I put the question as to whether honourable members approve the remaining items on the schedule described as NGS 55, tertiary medical care at various local and overseas institutions in the amounts of $43 million in 2026, $43 million in 2027. NGS 74, preservation of natural environments and places of historic significance, $570,000 in 2026, $570,000 in 2027. NGS 92, Alzheimer's and Dementia Association of the Cayman Islands, $125,000 in 2026, $125,000 in 2027. NGS 95, Multiple Sclerosis Foundation of the Cayman Islands, $25,000 in 2026, $25,000 in 2027. TP 44, Temporary Poor Relief Payments for Young Parents Program, $50,000 in 2026, $50,000 in 2027. TP 73, Other Health, Environment, and Sustainability Program Assistance, $200,000 in 2026, $200,000 in 2027. TP 111.
Mr. Chair, I have a question on TP 111.
And if members, so those in favor of the aforementioned red output groups, please say aye.
Aye.
Those against, no. The output groups up to TP 73 forms part of the schedule to the bill. TP 111, Climate Resiliency Program. Lady Member for Cayman East.
Thank you, Mr. Chairman. Through you to the Honourable Minister, I wonder if she would take this opportunity to say what the $200,000 is for in 2026 and why it is not needed for 2027.
Honourable Minister.
Doesn't say anything. Mr. Chair, through you, just can I ask for a minute, please? Mr. Chair, through you, I think I can safely answer by saying that this project, as some members might recall, this is where we were going through the public sector buildings and assessing them to determine their energy efficiency and doing energy audits and retrofits, and then providing the staff with training to strengthen technical capacity across the public service. So we just budgeted to continue the program for 2026, and then we're looking to, like, we didn't have a commitment to doing it for 2027.
Mr. Chairman, I'd like to thank the Honourable Minister for that clarification, because in the very detailed notes, I couldn't find it, so that's the reason why I asked. It just jumped to 112, and I couldn't find 111 in your explanatory notes. So you might want to rectify that when you put it out to the public.
Thank you, Mr. Chair. Through you, I'd like to thank the member for pointing that out, and I'll ensure that the member from the team requests that we edit that to provide an explanation. What I can say as well is that we previously did quite a few of the energy audits with the public sector buildings, including this Parliament, and I think some of the other, the post offices and some of the, so I think a lot of the major big buildings have already been assessed, and that's the reason why we hadn't considered 2027.
So continuing with our approvals of the output groups, in accordance with Standing Order 833, I put the question to the honourable members to approve the following items on the schedule. TP 111 Climate Resiliency Program, 200,000 in 2026, nil 2027. TP 112 Community Support Programs, 200,000 in 2026 and 200,000 in 2027. OE 15 Pan American Health Organization subscription, 15,000 in 2026, 15,000 in 2027. OE 66 United Nations Caribbean Environmental Program, 7,500 in 2026, $7,500 in 2027. OE 103 Caribbean Public Health Agency, $20,000 in 2026, $20,000 in 2027. OE 127 Caribbean Association of Medical Councils, $1,500 in 2026, $1,500 in 2027. OE 133 Oil Spills Tier 3 Annual Fee, $75,000 in 2026, $85,000 in 2027. OE 152 Maintenance of the completed Georgetown Landfill Remediation Works Phase 1, $498,000 in 2026, $498,000 in 2027. EI 29 Health Services Authority.
I have a question on EI 29, Mr. Chair.
So all those in favor of the previously read appropriation groups, please say aye.
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 Those against, no. The previously read appropriation groups are approved to the schedule to the bill. EI 29 Health Services Authority, nil in 2026, 5 million in 2027. Are there any questions?
Thank you, Mr. Chair, for recognizing me shortly.
Lady Member for Cayman-Bragg East.
Thank you, sir. I just wanted to ascertain that it was not a scrivener's error for the 0 in 2026, and if not, what was the justification for 5 million then in 2027?
Mr. Chair, through you, it wasn't an error to the member. Thank you for your question. The reason why there isn't anything in 2026 is because we looked at the timing, and by the time we did all of the procurement as well as the plans and to go through planning, we suspected that would take us the majority of 2026 to complete that phase, and then we would start construction in 2026, which is why the 5 million is there. And sorry, 2027 and not 2026. That's why it's there.
So I take it in all of the preliminary plans have been already paid for, that you couldn't do next year in anticipation for start knowing how long it takes to get things through the system, procurement and otherwise.
Just 1 minute, Mr. Chair. Thank you, Mr. Chair. Just to answer the member's question, we've started preliminary discussions, but we are the very initial phase of the plans, and HSA would be paying for that from their OPEX.
Member for Bordentown West.
Thank you very much, Mr. Chairman. Mr. Chairman, through you to the Honorable Minister. What major capital projects do HSA have planned over the next 2 years?
Honorable Minister.
Mr. Chair, can I just converse with the CEO, please? Double check. Mr. Chair, through you, can I just clarify from the member, if you can be a little more descriptive when you say major, do you mean anything over a certain threshold? 10 million?
I'm going to help you all right now. Please turn to page 537 of the ownership agreement. Mr. Chairman, I am sure when you read the statement of cash flows, you know the number that I'm looking at. Now, I tell you what.
I also see the balance sheet, and I do see the cash and cash equivalents.
And you see and you also see what it is for depreciation. You see the non-cash type stuff.
Right.
So, well, you know the number I'm looking at, so I'm just curious as to what is driving that number.
No.
Mr. Chairman, in the interest of time, is the CFO for the HSA here? I tell you what, Mr. Chairman, in the interest of time, they can send me the list at a later date. I don't want you all to accuse me of not being nice.
Member, I turn your attention to 506 and you see your Bordentown dialysis clinic.
Oh, it's coming out. No, well, listen, if you come out.
So with that, and in accordance with Standing Order 833, and given the fact that the Minister of Health is looking out for the District of Bordentown, I put the question to whether honourable members approve the following items.
Sorry, Mr. Chairman, before you move off of that, the stuff on 506 don't add up nowhere close to that number.
Oh no, there's more. Yes. So
yeah.
Obviously.
So we're clear.
Yes.
So, but as long as Bordentown getting a new hospital and dialysis, we're good. Continue. You can take the vote.
We approve the following items on the schedule described as EI 29 Health Services Authority nil in 2026, 5 million in 2027. EI 94 Minister of Health, Environment and Sustainability, $15,564,000 in 2026, $8,483,000 in 2027. EA 30 Cemetery Vaults Grand Cayman, $620,000 in 2026, $672,000 in 2027. EA 1.
I got an amendment in EA 146 that I filed, Mr. Chairman. Yep, I have an amendment there.
And so we take the aforementioned three items on the schedule to form part of the bill. All those in favor, please say aye.
Aye.
The ayes have it. Member for Bordentown West, you've indicated that you did file an amendment. I don't see it in front of me, but
I'll read it. I sent it for the 13th day of November 2025. And it reads, Notice of Committee Stage Amendments. In accordance with Standing Order 84 of the Parliament Standing Orders 2025, I, Christopher S. Saunders, elected member for Bordentown West, give notice to move the following amendment to the Appropriation Financials Year 2026 and 2027 Bill 2025. That Ed EA 146, land purchase for conservation, be transferred from the appropriations to the Minister for Health, Environment and Sustainability, and be transferred to the appropriations to the Minister of Planning, Lands, Agriculture, Housing and Infrastructure.
Member, you've moved an amendment for the transfer of an output group. However, we have already taken the vote on the appropriations. So we wind up with a small conundrum in that we need to ensure we approve the output group before we transfer it. And that's why I was trying to get through them and then come back, because I remembered you had filed a motion. So I would rather take the vote on the output groups because we need to have them approved before we can do.
I don't think that, I think we can actually do the amendment before we take the vote, because then you take the vote.
But if we take a vote and we transfer it to a ministry that's already been disposed of, I would think that that would cause us a small issue versus just approving the item as part of the appropriations and then agree to transfer that approved item to another minister, because that's what we're looking, that's what, if I understand it, that's what your motion is seeking to do.
May I, sorry, may I, Mr. Chairman? I understand the logistics of the sequence that you just explained, which is probably the journey of least resistance at this juncture. But and I haven't seen a motion, I'm sure it's been circulated, the amendment motion has to be voted and disposed on, because if it's the government's position, for example, that you don't agree with the amended motion, then it's a fait accompli. Otherwise, you'll have two motions on the floor at the same time.
Perhaps we're splitting hairs, and quite honestly, as long as we are aware that we have not approved this item, and members agree that we have to circle back and approve the item with no issues being raised. So the mover has moved a motion. Does the mover wish to speak to the motion?
Yes, Mr. Chairman. Mr. Chairman, we have a ministry that is responsible for lands constitutionally. And I don't think it's in the best interest that we start having different ministries now within core government start owning real estate, because it defeats the purpose of having a ministry of lands that have the Lands and Survey Department and all the support and stuff to go with it. So if this is a situation, you might as well have other ministries now start going out and buying real estate. So there's a reason we specifically have a ministry of lands. And I don't think it, regardless of whatever the land is being used for, it is still land. And I think it should be under the Ministry of Lands.
Thank you very much. And the government position is that we're in agreement. So I put the question to the committee that EA 146.
Mr. Chairman, I do apologize, but you're in the middle of a debate. You have to ask if there's any other members that wish to speak.
I just thought that at this hour, given the fact that we are in agreement, Member for Georgetown Central, I know that it's been a little while since we heard from you, so I call in the member, I recognize the member from Georgetown Central.
Thank you, Mr. Chairman. The reason why I had to contribute to this, and even though there's agreement, is this is a new area of test. This provision within the standing order, as long as I've been here, and it's my third term here now, have not been used. And it's important that we recognize the provisions available to each member to do so, because I'm very mindful of 2027 budget that is coming up, or the sitting of 2027 for the 28-29 budget, that in the event any shenanigans happen again, because we will be going through the process of filing the relevant motions where every member will be subject to a debate. So this is just a test. It goes well now when it's all in agreement. But in the event that the next time around when there's a budget debate that needs to be done and members decide to try I don't want to explain all the facts of what I'm doing, and then I'll go down in Finance Committee and read a statement. Be minded, not trying to be difficult in any way, but the intention this sitting was to be a little bit more difficult than what as easy as the good member from Bontown West has done, because we could have had a debate on every single one of these ministries all over again as per the standing orders. So I'm glad to hear this agreement. I think it'd be important to hear from the Honorable Minister herself as to the acceptance of the motion that has been moved before this committee and what exactly the parameters of that acceptance would be, because I would love to vote in favor. But acceptance, what does acceptance mean? Is it specified as in the whole output group will disappear and the monies just go to the other output group? Because I don't even see the need for this line item, to be honest with you. As the good member have highlighted, we already have a place where government buys land. So with that in mind, I would just want to hear the specifics as to what this agreement is. I don't think it should just go right back to the mover of the motion, but obviously I'm at the mercy of the House and each member is privileged per the standing orders. But I would like to have clarity as to what the agreement is so I know myself as one of the members of this committee how to vote. Thank you, Mr. Chairman.
Does there any member wish to speak? Does any other member wish to speak? Does any other member wish to speak? If no other member wishes to speak, does the mover wish to exercise his right of reply?
Yes, Mr. Chairman, I just want to thank the government for accepting the motion and to move all of the land purchases into one Ministry of Lands. Thank you.
The question is that EA 146 in the final appropriation bill be transferred to the ministry responsible for lands. All those in favor, please say aye.
Aye.
Those against, no. The ayes have it. In accordance with Standing Order 83.3, I put the question as to whether honourable members approve the following items on the schedule described as EA 146, Land Purchase for Conservation, $50,000 in 2026, $50,000 in 2027. EA 162, Protected Area Management, $50,000 in 2026, $50,000 in 2027.
And then you did what?
We didn't approve it as yet. You all. And that's why what I was saying was right. In accordance with Standing Order 83.3, I move that honorable members approve EA 162, Protected Area Management, 50,000 in 2026, 50,000 in 2027. All those in favor, please say aye.
Aye.
The item stands as a part of the schedule to the bill. EA 146, to be appropriated to the minister responsible for lands. All those in favor, please say aye.
Aye.
Those against, no. The ayes have it. In accordance with Standing Order 83.3, I put the question as to whether honorable members approve the item on the schedule described as EA 146, Land Purchase for Conservation, 2026, $50,000, 2027, $50,000. All those in favor, please say aye.
Aye. Aye.
Those against, no. The ayes have it. Members, this concludes all appropriations of all output groups having been approved by the committee. I recognize the Honorable Minister responsible for Health, Environment, and Sustainability. Just members will take a 2-minute recess, but we'll stay in our seats and then just explain what the minister is seeking to do. Members, sorry, let me call Finance Committee back to order. Please be seated. Members, I must admit that when I received a copy of the motion, I thought that this had gotten distributed to members. I did not realize it was still sitting here at the desk and hadn't been distributed. So my proposition to the minister is the House has to come back in December, and members now have a view of what the minister is going to be seeking to get approved in December. This is a motion that can be moved at any point in time, and she'll move it at that point. Please ignore the line on CAT eradication. The items, in accordance with Standing Order 83-4, I shall put the question as to whether honourable members approve of the schedule as amended by Finance Committee forming a part of the bill. All those in favour, please say aye.
Aye.
Those against, no. The ayes have it.
Mr. Chairman, I know we are almost done. Have you formally withdrawn this motion?
The motion has not been moved.
Okay. Was it submitted? Was it submitted? No. You have to do a formal removal if it's been submitted. You heard Chris do it 3 times already for the sitting. He didn't have to move it, he had to withdraw it. I've asked if it was submitted. Madam Speaker, Madam Chair, Madam Clerk, has this been submitted?
This motion was circulated?
No, it had not been circulated. Just now.
Okay, if it's circulated, it's a different thing from submitted with the signature on it to you. I think for good administrative process, it's on record that there was a submittal, right? I don't think we can get around that. I think that the fact is, for clarity, just say that it's being withdrawn until a later date. But you can't pretend like this document isn't live. It is live. I don't even want to get into what in the document, no. Because we're double dipping money for Botanic Park, and we already voted on Botanic Park. I don't understand that.
Honourable Minister for Health, Environment and Sustainability. For clarity and for my sake and the chair's sake, can the Honourable Minister say whether or not this motion, because the copy I have is unsigned, has it been signed and submitted to the clerk? It has been. Minister, can you at this point withdraw this copy of the motion, and we will then have to deal with this at the next meeting of the House?
Mr. Chair, I move a motion to withdraw the resolution.
Thank you. In accordance with Standing Order 83-5, I put the question as to whether honourable members approve Clause 1, standing form of the part of the bill. All those in favour of the motion being withdrawn, please say aye.
Aye.
Those against, no. The ayes have it.
Mr. Chairman, can I have a division, please?
A division on the withdrawal.
Yes, sir. Thank you.
Madam Clerk, can we have a division on the withdrawal of the motion? No problem.
Honorable Andre Ebanks.
Yes to withdrawal.
Honorable Gary Ruddy.
Yes to withdraw.
Honorable Catherine Ebanks Wilkes.
Aye.
Honorable Johanny Ebanks.
Yes to withdraw.
Honorable Isaac Rankin.
Yes to withdraw.
Honorable Nicholas DaCosta.
Yes to withdrawal.
Honorable William Panton.
Aye.
Ms. Heather Bodden.
Aye.
Mrs. Julie Hunter. Absent, sorry. Honorable Michael Miles.
Yes to withdrawal.
Honorable Joseph Hugh.
Aye.
Honorable Kenneth Bryan.
Aye.
Honorable Perlina McGraw-Limsden.
Aye.
Honorable Juliana O'Connor Connolly.
Aye.
Mr. Royston Tatum.
Aye.
Mr. Roy McTaggart.
Aye.
Mr. Dwayne Seymour. Absent. Mr. Christopher Saunders. Absent.
Results of the division, 15 ayes, 3 absent. The motion stands withdrawn. Thank you, Madam Clerk. And I start again in accordance with Standing Order 835. I put the question as to whether honourable members approve Clause 1, standing part of the bill. All those in favour, please say aye.
Aye.
Those against, no. Clause 1 stands part of the bill. The question is whether honourable members approve Clause 2, standing part of the bill. All those in favour, please say aye.
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 Those against, no. Clause 2 stands part of the bill. The question is whether honourable members approve Clause 3, standing part of the bill. All those in favour, please say aye.
Aye.
Those against, no. Clause 3 stands part of the bill. So, honourable members, we have approved the schedule and clauses 1 through 3 forming part of the bill. Therefore, in accordance with Standing Order 837, I shall put the question as whether I, as chairman of the committee, do report the bill to the House. All those in favour, please say aye.
Aye.
Those against, no. The ayes have it. The bill shall be reported to the House. This now concludes the proceedings in Finance Committee. But before ending the proceedings completely, I call on the Honourable Premier to give, I give the Minister of Health, Environment and Sustainability an opportunity to say thank you to her staff.
Mr. Chair, I would like to take a minute to thank all of the staff that work under the remit of the Ministry of Health, Environment and Sustainability. I want to also just take a moment to thank the member for Prospect for acknowledging the DEH staff for their efforts. And as you, Red Bay, sorry. I just want to say that I'm proud of, all of our essential services that fall under the remit of the ministry. We have medical staff, we have the MRCU teams, we have the DEH garbage collectors. A lot of them often go unnoticed. So as I go into thanking the team here, I want to take a minute to pause and thank all of those who I think we often forget that they're busy working. So I wanted to just thank them. And then as I was thinking about closing, I just wanted to say that through the scrutiny of the budget that is for the remit of my ministry, I wanted to taking away from these deliberations today, that I'm going to take the policy on spare guns to Cabinet for approval as soon as possible, as well as a review of the current method of euthanization of cats. I would also like to thank Chief Officer Tamara, Director Sims, who we all heard today. He's celebrating his 35th anniversary as a civil servant, as well as our Director, Judith Seymour, who has been a civil servant for 37 years. And 20 of those years she has been with the Council and Services. Also, Director Gina, who works very hard with her DOE team, Dr. Wheeler, who I got to appreciate even more recently all the hard work that they do with MRCU, CEO Lizette and all of her staff, her CFO, CMO Wolf, who is new but has come and fit right in. She was actually ready to stand in tonight for any questions that would have been asked on public health. And then Director Lockhart and Mullings and all of their teams. It's a big team, but I really wanted to take the time to acknowledge them earlier today. And I think some of them are still here. A lot of the staff was up in the gallery. They took this deliberation of our budget personal, and they wanted to be here to offer support, to learn, and to see the process live. And I thought that fit with what Mr. Speaker has been doing with making Parliament a place where people want to be. So I want to say thank you to each and every one of you. I think I've done more than enough today, almost 9 o'clock, but I'm happy for the questions. It's given me an opportunity to share with the members of the public what we are going to be doing as it relates to the ministry and all of the works that are under my remit. So with that, I say thank you, Mr. Speaker. Mr. Chair.
Thank you very much, Minister. And
Mr. Chairman, no, I can't help it.
We do know.
I just want to...
Member for Georgetown Central.
Thank you, Mr. Chairman. I just want to say thank you to the amazing staff for the minister's portfolio. We here in the opposition do appreciate all the hard work that you do as well. But a special appreciation for the minister herself. Handled herself well today. It is not easy all the time to take difficult questions and keep your composure and don't get upset because you know all the hard work your team does. So I think you did an amazing job, so shout out to you, but particularly to your team that makes you look good. Guys, keep up the good work. God bless you and have a good weekend.
To members, I thank all members. It's been a robust series of questioning over the last week. I think the public has been well informed about the details of the budget, and I think the scrutiny is a hallmark of any solid democracy, and it illustrates that our system works. So I thank all of you as members. Thank you for all of your support. I know every once in a while, as chair, I have to take deep breaths. So I thank all of you for being patient with me in my first tour of duty in this chair. And certainly, I hope that there wasn't anyone that I made feel in any way. If I did, I apologize. But this committee is a serious one, and our work is very, very important. Last but by no means least, let me also thank Madam Clark and all of the assistants who sat in. Thank you for all of your support. You have a lot of work to do to finish the report, but the good news is, as we all know, they always work as we're going along, and most importantly for me personally, I want to thank the Financial Secretary and the entire team, Mr. Matthew Tibbetts, Ms. Ann Owen, Mr. Michael Nixon, for all of your hard work and all of the hard work in the I want to thank Karen Rivers, those in the budget unit. I know I'm going to get myself in trouble, so I'm going to stop there. I just want to thank all in the Ministry of Finance who has gotten us to this point. A lot of hard work has gone in, a lot of hours, a lot of weekends in the office, times that we don't, work that we don't see and we often take for granted when we get these documents and be able to go through them and perform our work. So most important work. And also the finance units in every ministry and all SAGCs, because your work feeds up to the ministry and gets the job done. So, Premier, do you want to offer a few comments?
I think you covered it adequately, Mr. Chair. I think we only left out thanking you.
No need for that. No need. This is my job. Don't thank me for doing my job.
No, but we have to thank you for doing it well. You even conceded that the member for Georgetown Central is a nice guy. So you're laying it on thick, sir. So thank you. It is a thankless job to balance budget, corral leaders. You've been a fantastic partner to rationalize a budget and get the job done and get the country here. Thank you, sir.
Thank you. And so it leaves for me to ask all honorable members to meet tomorrow, the 20th of November, in the committee room at 11 a.m. to approve. I assure that the clerk has told us she'll be ready. We have a fantastic clerk and her team. No, the House would be Friday. So to approve the report of the committee tomorrow at 11 a.m. and let's get it out of the way. Unfortunately, there's a number of us that have a huge funeral in the district of West Bay on So members, in true collaborative and fashion, let us meet on noon on Friday to consider the report, and the House would then be called at 2 p.m. so that we'd have the third reading of the appropriation bill. I call this meeting of Finance Committee adjourned until 12 p.m. on Friday.